everybody. What's good? How's everybody doing? Brandon, DJ, A Banana, Bob the Turtle. What's good, y'all? I see you. I see you all here. How's everybody doing? Oh my gosh. I just had to deal with the most insane traffic. My entire fucking state decided to put rotaries in everywhere, and no one in Massachusetts knows how to drive on a rotary, so it's fucking crazy. People are fucking crazy. Ooh. Yeah, the traffic was insane. I was supposed to be home an hour ago. An hour ago. And no one knows how to... They're all doing road work. And I didn't know on the way home that there was going to be all back roads. And I didn't know how to navigate the back roads, so I got lost a little bit. And then, yeah, it was a mess. It was a mess. So we're hopping on Elaina right now. And we're just gonna see how it goes. Not a lot of people were on today, and so not the reason why I didn't really rush that much. Hey Adder, how's it going? So we'll see what happens. But yeah, I didn't really rush that much to get home. I was kind of flying. I kind of ran some stuff. I'm not gonna lie, but I may have not obeyed traffic laws. I may have pulled it on Arya and just fucking sent it. But yeah, we're gonna hop on Elaina right now. I don't know what's gonna happen day one of Elaina. We'll try our best. Not many people were on when I looked, so we'll see what happens. But it seems like people are hopping on, honestly, actually. Damn. Takers! Maybe I should get on. You want to go get her so Elaina can treat you? You should get on. Takers, you have a special new thing on your name. You saw it. You've been in the chat. You've been in the chat so much that I gave you a badge. This is weird, I'm not playing Arya. I like it though. It's a good change. Alright. Let's go. Let's go get on duty. Oh shit. Change is always welcome. I forgot to put the game up, guys. Not playing Arya, I'm scared. Look at Elaina though, isn't she cute? She's got some features that I don't think I should change, honestly. I kind of like it. She's got some charm to her. She got them rosy cheeks. Yeah, because she's always nervous. That's why. She's always nervous. shit, there's 2 doctors.
Everything was, all the check marks were checked, then I did my job. So that's kind of the way I look at it. Hello.
Hello.
Hello. How are you?
Good. How are you?
We are good. We're just catching up.
Oh, nice. This is so weird.
It's a little bit quiet today, but hopefully we'll get some calls in.
Hopefully, I'm gonna go get ready.
Okie dokie.
Oh, is this a new staff member?
Yes.
Wonderful.
Wait, have you not met her yet?
No.
Crikey. Well, we can do introductions in a jiffy.
Crikey.
Sounds good.
I love his.
The portal being down a few days ago was a bit stressful, not gonna lie, but
Oh, was it?
I mean, just worrying about if I got eyes contact updates come in. I made a spreadsheet for it, but just keeping up with it after the fact was a little bit stressful. But I think I had everything that I needed to in there.
We get it periodically. It's always nice to be prepared, but thankfully, if you have a spreadsheet for it, you are prepared.
Do we do that, or do you guys want to do a nurse outfit?
Yeah, and it was a short downtime. I think it was only a day or two, so.
Yeah,
you want to do this or nurse outfit?
Are usually relatively
Which
quick
one?
at getting things back up.
I'm letting you guys check. Nurse? Okay. She looks so good. Holy shit.
Okay, it's working. I had to make sure.
Let me pull up the...
Thankfully. The last thing we want is it to be going down again.
Right. Yeah, the 3 things I keep on my tablet are treatment guide, RSOPs, and the portal. Those are the things I keep up. I will go ahead and put an ad out, maybe if anyone wants to come in and give blood or something.
Yeah, I mean, checkups are always good.
Right.
She's pretty adorable. She's pretty adorable. Shit. I'm trying to get my shit together here. Hold on, guys. Okay. Let's turn TeamSpeak on so we can hear the radio. Hi, Nitro. How's it going? Hi, Coyote. Hello. She is cute, pretty cute. I'm not gonna lie. She's got one of those faces. Good. How's the server tonight? It's kind of quiet, but that's okay. Actually, you know what? He looks so cute. Oh, hello?
Hello, sir. I don't believe we've met before. My name is Dr. Gregory Simons.
Nice to meet you. I'm Elaina. Elaina Reyes.
Pleasure.
Yeah.
I had no idea you're a new staff here when you walked in, so but yeah, it's nice to meet you.
Nice to meet you too. Yeah, I haven't been a little nervous to start, you know.
Don't be nervous. It's fine. Don't worry about it. We're here if you need any questions answered. Just ask away. That's what we're here for.
Okay.
Particularly if it's quiet. If it's quiet, it's nice because it means that we can go more in depth into specific questions you might have. So don't worry about it.
Okay, cool. Sounds good. She's like,
What would you say you are most nervous about?
Is saying everything too vague?
Okay. Well, no, it's not. No, because if everything is new to you, then it's one of those things where you're going to learn and we'll take every case as it comes, and every case for you is going to be a learning experience, which is fab.
Yeah.
Hello, Nurse Blackwell.
Hey, how's it going?
Hello.
Hello.
Oh, are you the other nurse?
Oh, yeah.
Oh, heck yeah, nurse buddy. Yeah.
Yeah. Nice to meet you.
Nice to meet you. What's your name?
Elaina Reyes.
Ah, okay. My name's Zach.
Nice to meet you.
You guys busy today?
No. Not yet.
Her phone is
no.
fucking dry, chat. Look
We
at
will
this.
find out
Quiet.
soon enough.
Look at this.
Oh no. You think you'll need
She
help?
has
Are you guys
Leon
gonna
as a
cover it?
contact.
Do you know what? I don't know. But if you're wanting to get on duty, I might see if we can go through some situations with you all, and see if we can
Oh,
do
yeah.
some learning theory wise.
Yeah. You guys, yeah.
Theory
I know I'm
training
still
helps
in-
me a
so,
lot.
like, a-
I'm not gonna lie. Scenarios are always really good.
Mm-hmm.
Everything's unique, but going over the general idea of what needs to be done for each specific injury or something is a really big help in my opinion.
Yeah.
Yeah. Okay, I'll go talk in.
Lovely.
So you were doing some updating to the guide.
Trying to work on it. Yeah, we're trying to get some. It needs to get updated. There's a little bit left to do. But as you said that you had gunshot wounds to deal with, I'm going to start working on those. So you've got a little bit of a follow through. It's just been awfully busy lately.
Understandable. The general layout of it is pretty helpful, to be honest. I mean, it really gives a good sense of direction of where to go.
Yeah. A lot of it's common sense, really. If there's bleeding,
Hopefully I'll make the
the
server in a
goal
little
is
bit.
to try and
Yes,
stop it.
Nitro.
Don't pack the wound if it's in the neck.
Yes. Typically, we don't pack in the torso because there's a lot of empty space there, and the last thing we want to be doing is packing. So by packing, we mean actually forcibly pushing in gauze into the wound. Typically, we won't necessarily be doing that unless we're trying to really stop bleeding during surgery. Our aim and goal is to try and stop that bleeding. That would be more of a pre-hospital thing, so we'll often get patients that come in with pre-packed wounds that EMS have done for us. So what we'll have to do is try and
Yeah, congrats on
get
getting
the
in the
source
server.
of the bleeding, try and ascertain what we're dealing with, then remove that gauze, and then try and deal with obviously the damage that has been caused that's resulted in the bleed, and then deal with trying to stop the bleeding more permanently.
Oh no, where'd the cone go?
The cone is in the seat around the corner by the changing rooms.
Did it do something bad?
I don't know. I have no idea what the cone is. I'm not even going to ask. The cone is seemingly its own entity now.
Yeah, I've heard he was moving out of nowhere, so they wanted to
Throwing
get a
little
more
legs.
secure location. Dr. Campbell, do you want to go back and run some scenarios?
We absolutely can. Yes, let's do that.
Oh, well. After you.
Oh, thanks.
Oh, I learned that removing the bullets for ballistics, by the way. Gotta learn that off
Oh,
the cuff.
yes.
Do you want me to be the dummy for today?
So, I mean, if you've learnt the trick of for ballistics, let them know.
Yeah. So one thing I learned, kind of in the heat of the moment, if you ever have a gunshot victim, make sure that you, how do I word this? Give them a helping hand when you remove the bullet and help them up, so we can get those bullets over for evidence for the police department to examine for ballistics.
Okay.
Okay.
It sounds very confusing, but in an actual situation, you'll understand.
We always want to make sure that we've given everybody a helping hand before they leave, particularly if they've had gunshot wounds. And because, like Dr. Simon says, if we do make sure that we give them a helping hand before they leave the hospital, everything all gets bagged up, put into evidence, and it gets sent over through the internal databases for the PD, and they can tie things to crimes and whatnot. So it goes through our forensics lab, down to them, and everything is all good.
Okay.
Okay, so scenarios. Let's have a think. Let's say, what's going to be a common one? Dr. Simons, what would you say is the most common one that you've had patients come in with so far?
MVAs or something of the like, being
okay.
hit by a car. Basically a trauma.
Okay, so let's start off nice and simple. Let's go for vehicle ejection. Oh no, motorcycle. Come off a motorcycle, and we've got a road rash. Okay, so this is going to be your bread and butter. We do lots of patients who have road rash, but it's Very, very simple. Do you guys know what road rash is?
Yeah.
Yes.
Okay. So that's good. So what we'll often find is that because a lot of people that ride motorcycles don't wear the appropriate safety gear, they'll often be wearing just regular trousers. What we'll find is that they do get quite bad road rash because they don't have protective clothing on. So the asphalt is going to have slid along their leg, or the leg's going to have slid along, or arms, or whatever. It's going to have burnt through, and it's going to have it's basically road rash. It's just a really nasty graze. So what do you think we would do to start with?
Clean the wounds.
Yeah. So initially, if we get brought in the patient from EMS, they'll come in, they'll give us a handover, they'll come in and say something like, "Hi, we've got a patient here. It's Gregory. He's been involved in a motorcycle accident. He's been alert. He's been conscious. There's no signs of a concussion or anything like that. He's just got some road rash on his arms and legs. So vitals will all be good. You don't need to necessarily check those. If he's alert, conscious, and talking, that's all fine. So yeah, what you would do is make sure that you can get good access to the wounds, and then clean them as best you can."
Okay.
We can do that with saline. So we can use either a blunt needle, so we can use a syringe with saline, and we can use that to irrigate the wounds, because obviously road rash is going to give us lots of little particles of debris in the grazes and the rashes and stuff like that. So we want to irrigate that as best as we can. We want to make sure that is all cleaned up, and make sure that we make everything sterile. That's going to be the biggest thing, because EMS don't tend to deal with cleaning wounds when they're out in the field. That comes down to us. So we need to make sure that there's no infection. We don't want people leaving here with infections. So a good opportunity to do that is to clean everything up as best we can, and then probably give them some antibiotics just to help make sure that everything is good, or at least keep it sterile. So, one of you, let's start with your assessment on Gregory here.
You go first.
No. You ladies first.
Or you can work together.
Oh,
Ooh,
yeah.
okay.
All right.
2 nurses is better than 1.
All right. Hello there, Gregory. How you feeling today?
Ow.
Feeling ow. You know what? I bet it looks pretty gnarly. What happened?
I was just riding my motorcycle and went over a speed bump, and I got the wobbles, and I slid right off.
Wow.
You weren't
My leg
wearing.
is hurting
You
pretty
dressed for
bad.
the ride, not for the slide, didn't you?
I was just wearing my khakis.
Oh no. All right. Well, we are gonna get you all cleaned up and help you be as best as you can, as quick as we can. All right.
You.
All right. So let me go get some saline and a syringe and gloves. Do you need gloves? You have gloves?
I got gloves.
Okay. I'm gonna go get.
She should just pat his leg and be like, "It's gonna be okay."
Also, if you're nervous, a really good way to deal with the nerves is to just chat to your patient.
Okay. How you doing lately? Besides, the obvious.
It's great, you know. I just bought this new motorcycle, but I crashed it.
It's gonna be okay.
Thank you.
All right. Let's see.
Whoops.
Okay. So you said it was your legs, right? Is that only where it hurts?
Yeah, it's mainly my right leg.
Right
So we have a couple of options when it comes to getting access to a wound. We can either, and this is the least favourable one for the patient, we can either cut the item of clothing off. More often than not, it's probably going to have been ruined anyway, or we can just help them off. And it depends on what's going on. Obviously, if you have a critical patient who's severely injured, we get our scissors out as quickly as possible, and the clothing comes off nice and quick. We just whiz straight up, get them off, and then we can go to work. We don't need to faff about. Obviously, if they've just been a walk-in, they can undress for you, and so it's not too bad.
Oh, okay, cool.
Alright, would you you feel well enough to be able to, like you said it was your legs, so would you like us to cut your clothing or remove your pants? I mean, I figure we're already a little messed up, but that's up to you.
I think I have another pair of pants in the locker room, I guess. You could just cut it.
Don't actually cut his trousers.
Damn.
Okay, good.
Right? Just gonna.
My pants.
My pants.
We have had, not in this hospital, but I have had medical students actually cut the pants legs or the shirt of someone pretending to be a patient, thinking that that was, yes. And it was a $50 pair of trousers as well, so.
Oh,
no.
shoot.
Yeah, these are nice pants. I don't want them cut open.
I'm just gonna roll up your pant leg. Okay.
You're okay. Just go ahead and proceed.
Cut them off. Chat, I'm not cutting his pants off.
Okay, it looks like textbook road rash. If you want to, let's see, we're gonna go ahead and put this little. It's just saline, so it shouldn't burn, but it might just because it's something going on your wound.
It'll probably burn a little bit. It's road rash. But usually it's okay.
So, when we're looking at the wound, particularly with road rash, there are 3 types of road rash, and they're similar to burns. So we have first-degree abrasions, second-degree abrasions, and third-degree abrasions. They're just really the depth of what we're dealing with. A first-degree abrasion is just like a surface graze, right? So it's not going to bleed too much.
That's bacon dono.
It's going to be relatively easy to deal with. It's just mainly surrounding the epidermis, so it's the first layer of skin. The second degree road rash is going to be going slightly deeper down. It's going to be damage to the epidermis as well as the dermis, which is slightly underneath, and it is going to bleed more than the first degrees, which are just sort of, like I said, surface grazes. But it's not going to bleed too much. You will get some bleeding, so you are going to make sure that you have to, again, clean all that up, and hopefully it will clot. Tends to clot on its own, because it's not massively deep, and typically the blood tends to look after itself. You might find some weeping with a little bit of plasma and stuff like that, but that's okay. And it's important in second degrees to make sure that everything is cleaned and that they come back in, or at least check and keep everything tidied up, and just make sure that they're not taking the gauze off or the bandaging too soon afterwards, because we need that to heal.
Okay.
Which one are we doing this as?
Well, we've also got third degree abrasions and road rash as well. They are very deep. So that's when you've had particularly like a rough section of road that they've come down on, and it's gone quite deep in. They bleed quite heavily as well. So that's going to require a lot more cleaning and excuse me, a lot more cleaning and a little bit more medical care on that front. So we'll let you choose, Gregory. Which one do you want to go for?
And just one thing to add, correct me if I'm wrong, but kind of the way I look at it is, in terms of steppings, it's scrape, cut, gash. In the way I look at it, from first to third.
Pretty much, yeah. So we can, you can, road rash is more. If you imagine, I guess it's like a graze with gashes in it.
Right. In terms of depth is what I mean.
Yes, exactly.
But let's go with let's just go with we'll go with medium. Let's go with the uh 2.
Yeah. So we'll see there. We're going to have, obviously, there's going to be some areas where it's first degree, and there's going to be some areas where it's second degree. So you're going to want to make sure everything is clean. And it will sting, like Gregory said, it is going to sting. Typically, a first degree, you just want to make sure it's clean. You don't always have to cover a first degree, but a second degree, I probably would, just to make sure that it's all clean. You could probably put a topical ointment on it. Some sort of antibacterial ointment will do, and then cover it up loosely, make sure everything's good. But yeah, the key is to try and get that bleeding sorted out, under control, and make sure that it's clean.
So I'm gonna start applying the saline. Be as gentle as I can. Got a little bit of debris in here. Got to get it all cleaned out. Looks like it's a. Yep, it's a second degree. We're gonna. Oh, thank you.
Some rocks in there and stuff.
Yeah, I see that. I'm gonna just. You wanna like kind of pick the rocks with the gauze a little bit here. I don't want to spray too hard. It might hurt.
If there are larger rocks, you can always just use a pair of forceps to remove them too.
Yep, tweezers, forceps, they're all good.
I should have done rocks.
All right, that should. It's about clean enough. Well, not enough, but it's clean. Do you want to wrap them up, or you want me to do it? Or actually, let's put a little bit of ointment on it first, because some places look a little bit deeper than the other ones, just to maintain,
Yep.
protection.
Yeah, topical antibiotic.
uh,
Try to hurt you as little as possible.
Oh, that feels
Not
nice.
too- Oh, thanks. So make sure you don't hurt worse, because nobody wants an infection.
No infections.
All right, still got that extra gauze. We can go ahead and wrap it up a little bit, because it does look like you may get some leakage, just because it is a fresh wound, and it's just try not to move it too much. And
Okay.
well, you can walk on it, but just like not gonna wrap the gauze tightly. We're just gonna wrap it enough just to secure it. But if it looks like it's seeping through like a lot, you could come back in and we could check it out. But it should be just like guess you could rewrap it, but just make sure your hands are clean, you're wearing gloves, things like that. But if you think it's too difficult, then yeah, just come right back in here and we'll do it for you, no problem.
Thank you.
Yeah. So the biggest thing to remember when it comes to changing to applying dressings, particularly on a wound that is weeping or bleeding, is make sure the sides are all sealed nicely. The last thing we want is to have any of that weeping or leakage actually going down onto their clothing or whatnot.
Yeah, so just
Get
like
a nice barrier.
medical tape.
If I can, a lot of the time, if there's an area where the wound is deeper, I'll put on some thicker gauze pads, and then I'll wrap that as well.
Good idea.
EMS? EMS?
Does it look all done there?
Yep.
Right, I guess just roll down the PLA and then we're good to go. Oh, wait, so we also would probably need antibiotics. Oh yeah, and his ID, yes. Thank you.
Can do. So you can do antibiotics. It depends on the severity of it, really. If you feel like it may have got infected, you can. Otherwise, cleaning and applying the antibacterial ointment should do the trick.
Okay. Do we actually have to do a report?
No, no, God, no.
Okay, thank God.
Just ready to get through, because the first time I treated a patient, I forgot to get their ID.
I gotta start remembering that too. Opening what? Mistake. Already, I see it. I'm gonna change my gloves.
Better already. Thank you, nurses.
I'm here. No, we're just practicing. You're welcome.
Okay. So that wasn't too bad, was it?
No, not too bad.
It's easier treating someone when they don't actually need it.
Yeah, it is.
Especially when they're cooperative.
Yes. Do you know what? We don't actually get that many uncooperative patients, which is
Did
nice.
the other day.
I've,
Last time
I've
I
had a
was here.
handful.
He's very insistent, no doctors. So I'm a nurse. So, hey, how you doing?
Yeah, we get them here and there, but for
Or chopping up Dolly
generally,
Pop
it's-
Live's character.
I mean, they have to be here, and they're here to be helped. So
Yeah, it's not that bad.
She must just go for the head and destroy the brain. Only way to stop it.
Pretty comfy.
Dr. Campbell, for my learning as well, can we run through a GSW?
Of course we can. Yeah, absolutely. Who wants to get shot?
Me. How do I get shot?
Okay. Bang.
Wait, are you telling me it's really that easy to get a doctor shot?
Yeah.
Help me!
Hello.
I've been
Memory
shot.
bank for later.
Gosh,
Kill
we've
him,
had
I've been shot.
doctors and medics shot in here plenty of times.
It
Well, I mean, you
hurts.
offered it
Get
out
the
to them,
shot.
and they took it hook, line, and sinker.
Yeah.
Didn't even think anything of it.
Yeah.
I think isn't there a therapist around here that maybe they should see about that? That was a little too willing.
It was a little. I mean, do you know what? You don't have to get shot in order to learn what it's like to be shot. You know, I don't want to experience it personally, but you know, these guys they're new, they're eager, they're wanting to. Learn.
It hurts. It hurts.
All right, saying,
Hey,
if
you're
they're
gonna
gonna
be alright.
volunteer to get
Looks
shot,
like it's
then
through and through
what'll
to
they
the
do if
shoulder,
they're
so that's not
bribed
too
with
bad.
$1,000 for a vial of morphine?
Am I gonna make it, doctor?
Nope.
I believe you are.
Oh
dead.
God, I'm not
Hopefully
gonna
not just
make it.
morphine.
I'm just kidding. You'll be
Just
fine.
Oh
saying,
God,
liability.
You'll be
Hey,
fine.
you know
who's
what?
gonna feed my
You do you.
goldfish?
Damn.
Okie dokie. Well, we're very lucky that he's been shot in the hospital.
I'm so lucky. I
Uh-huh.
can't wait to tell my goldfish.
Okay, so let's. Did you just say can't wait to tell the goldfish?
Wait, what was that?
I
Did you say
believe
you
they
can't
did.
wait to take? You can't wait to tell your goldfish?
Yep.
Yeah, Goldie's
heard
gonna
that.
be so excited when I get home.
You know what,
I'm
Dodd?
acting.
Disregard
I'm
my
acting.
previous commentary. I can see why he's suicidal now.
I'm just acting. It's fine. I don't really have a goldfish.
Okay, so let's pop him up onto the bed.
Go.
Okay, so we're going to be looking at airway, breathing, and circulation. To start with, we want to get a good read on vitals. So, vitals tend to be dependent on the type of gunshot wound that we've got, depending on where it is, what it's hit.
It
Obviously,
was
if it's hit an
down.
artery or something like that, then the blood pressure is going to be dropping quite rapidly. Sometimes vitals tend to be okay. Sometimes vitals tend to be a little bit elevated. It all depends on the patient.
Yeah.
Okay, so we got heavy breathing, slightly low heart rate. Airway is
Complicated.
clear, so no need for eye gel or intubation.
Mhm.
Probably can give them. Well, if they're breathing heavy, we can have them focus on their breaths. I don't believe we would need to give them an O2 mask at this point, correct?
Always give them an O2 mask.
Let me
Okay.
breathe, doctor. Let me breathe.
Because oxygen will help ward off shock. It helps calm your patient down. It also means that if they are breathing shallow, it means they're not going to be oxygenating themselves well enough, which means that it can have other complications as well. So if we can give them some supplementary oxygen, it's always helpful. So yeah, always, when in doubt, give them an O2 mask. It just helps.
I'm just gonna give them low oxygen since this is just
Yep.
a scenario. Okay, so we have a through and through on the left shoulder. So we locate entry and exit, and we would cat tourniquet and pack with Celox.
So we don't have. So the guide is a little bit out of date. So what we'll do now is I'm going to be going through it with you as we are full learning mode. So this is not going to be going off the guide, okay?
Okay.
So we're not going to be packing because we don't need to. We're in the hospital now. What we're going to be doing is looking. We're going to be inspecting the wound. We can either send them back for an X-ray, make sure everything is good, make sure there's no damage in there. So for the time being, if we wanted to do that, we can put some gauze over the top of the wound, get them in for a quick X-ray, check out the wound, see how bad it is. If it is a through and through, you can just do a visible inspection of the wound. Obviously, when a bullet goes through, you'll be able to see it does cause an awful lot of damage. So we can have a look through, you'll be able to see where blood is coming from, but our main process is going to be stopping the bleeding. So we can do that through a number of ways, depending on what it's hit. If it's hit any arteries or anything like that, you'll know about it because it'll be hosing, which means that it'll be spraying everywhere, which is not ideal.
We look for any shrapnel check for any ruptured arteries or blood vessels.
Yep, exactly. So shrapnel-wise, that's what an X-ray would be good for. We can send them in. It'll come back. It'll show us if there is any foreign bodies or foreign objects in there. We'll then know the location of them as well if we need to do exploratory surgery to get them out, and then we can come back and yeah, start working on them.
So basically, get bleeding stopped. If it's heavy bleeding, we would get them
Nurse.
on ringers and TXA, and then get them sent back.
So again, because we're in the hospital, we can actually give them blood products. So we're here. EMS tend to give ringers and saline because they don't carry blood products. We do. We've got loads of it because we do our lovely blood drives. So the best thing to replace blood with is blood.
Okay, so just transfusion.
Yep.
Yep,
So if they've lost a decent amount of blood, yeah, we can get them on a transfusion. It just helps really. Again,
Okay.
it depends on how much blood they've lost.
And EMS
Doctor.
generally start them on TXA anyway, correct?
Correct. Yeah.
Sorry, what was that, Blackwell?
My shoulder feels like it peed itself. What happened? Am I
It's
being
a
too
good
much? I'm
assessment.
just trying to be in character. I'm sorry.
No, it's fine. Don't worry.
Perfect, fine.
Okay.
Okay, so gauze pads, X-ray, and transfusion if there's heavy bleeding.
I'm starting to feel cold.
Okay, perfect.
So, we'll send back the scans. What would the scans come back saying?
Light shrapnel, medium bleeding.
So
Okay, so in that instance, we would be trying to get the bleeding under control first. So we can use a mixture of stitches, we can use cauterization, and yeah, it's just generally trying to seal up the things that shouldn't be bleeding, really.
yeah, I was gonna say cauterize small blood
It's
vessels. If
Bacon
there's
Donuts
a
nurse.
ruptured
We're practicing
artery,
on him.
they would need a shunt and stitching for the surface level wound, correct?
Yeah, we can clamp for a short period of time to try and repair. So it has to be done relatively quickly. But yeah, and you can shunt as well. Again, it depends on the severity of the wound. We just need to repair it as best we can, which can all be done obviously with dissolving stitches and things like that.
And I mean, a bullet wound to the shoulder. I mean, really, the main artery that we'd be concerned about would be the thoracic.
So there's the problem that we have with shoulders is that if the bullet hits bone, it can send splinters out into various different places. There have been cases where people have been shot in the shoulder and the bullet has actually come out the side of their chest, which does happen very rarely, but it does happen, so it can cause an awful lot of damage.
Okay.
I'm trying to focus.
I know in school, kind of throughout that area there, the thoracic artery runs through there down towards the ribs with the smaller arteries. So if it's just a bullet that went straight through, most likely, you know, a not a what was it, a hollow point that will shrapnel or pancake, that would typically be what would cause a complication if there was no splintering or anything.
Yeah, so your main, I believe it's the subclavian artery, goes through the collarbone, or behind the collarbone, and it will go more towards. So if you imagine the fleshy part of the shoulder, and then come in a few inches, it's probably where your subclavian is going to be going. As you said, that's going to be going down into the arm as well, and then back up into the heart.
Okay. Perfect.
So if it's in the fleshy bit, it should have missed everything. But the fleshy bit sometimes has a fair bit of bone in there as well, so there is a chance that it may have splintered off. It may have hit the subclavian.
Okay, and at that point, we would have to open up the patient and repair any damaged arteries or anything.
If the bullet has hit an artery, you'll know about it.
Right.
Gushing is probably the right word.
I would be a fountain.
You would, yes, you would absolutely be a fountain.
Oh my god.
And then at that point, continuing transfusions throughout would.
Yep.
Until that's clamped or shunted, it would
Yeah.
be almost a null point at that rate.
Yeah, if they've come in with arterial bleeding, forget the scans. You need to control that bleeding and get that sorted out as soon as possible. And it's a tricky one because we can't do anything with if it is a shoulder injury, we can't tourniquet it because there's nothing to do. So we just need to get in there as quick as we can, as best we can, and try and get that sorted out.
Could get like a shoulder sling too or something, right?
Afterwards,
Stability. Yeah.
you'd be in a sling.
At that point, they would need a rod or something.
Who plays
in there
Vance? Because this is fucking funny.
Put that together. That definitely helped better prepare me for more GSWs.
So yeah, with gunshot wounds, the best thing for you guys is going to be straight into surgery or scans first. Make sure that there's no debris or anything like that, or shrapnel, and then into surgery. Make sure everything is all tidied up. Make sure there's no shrapnel or anything left in there. Obviously, I've written in the guide that what we want to be looking for is assessing the risk of removing things. If there is a chance that you might nick something by removing it,
That's Z.
you need to err on the side
I love
of
Z.
caution. Weigh it up. You might be able to remove something. Obviously, it does get problematic if there's a bullet by a... We've had, actually, there was a case study of an individual that had a bullet lodged in their heart wall.
Oh god.
There was research that said the best thing for the patient was to actually leave it there.
No more MRIs.
I believe what happened was the heart healed, and I think it pushed the bullet out, from what I remember. I can't remember. It was a long, long time ago since I read that case study.
Wow.
Wow.
That's rough.
But also spinal. If there is a bullet next to or nearby your spinal column, again, it's going to be a caution thing. If you are at any risk of nicking anything in the spinal region, it may be better to leave it where it is.
Thank you.
You're welcome.
But again, it's a risk reward thing.
That would be a really tough call, especially in
Yeah.
the spinal cord or something like that.
Yeah. For this, and for most, the general procedure for gunshots is going to be in, control bleeding as best you can, scans, check, clean with, by clean I mean, remove any debris, bullet, whatever, tidy everything up, suture, make sure everything's tidy, and then clean again, gauze up, and then make sure that everything is good and not moving.
I'm writing down notes. I feel like I'm at school. Damn it.
Hey.
Obviously, it gets more complicated if you've had, punctured lungs and things like that. So, yeah. But the process is still the same. It's if there's a hole, we need to fix it. And unlike you say, you can do that with electrocauterization. You can do that with dissolvable stitching and whatnot.
Okay.
So, Elaina, most of what you're going to be doing is either assisting or prepping. Okay, so you're going to be helping with prepping a patient for surgery. You'll probably be taking them down to get those scans done. So you're going to be the one that's going to do, put your fingers in your ears, Gregory, most of the work. So you're the important one here. The nurses are always the ones that typically do the most work. So they're going to be prepping the patient, making sure they're okay, and they're going to be the ones talking to the patients. The doctors, we just swan in later and stitch people up and faff about. And actually, no, you'll probably end up stitching people too.
Don't let
Yep.
them talk you into doing their reports. That's not your job.
Oh, really?
You do your own
Oh yeah,
reports.
They
make
do
sure
that?
make sure the doctors do their own reports.
Sick.
Yes, they do.
Something to add to that wasn't an aim at me, by the way.
Oh, okay.
Yeah,
I
no, that
enjoy
wasn't
doing
aimed at you.
reports.
That wasn't
It
aimed at you.
wasn't at all.
Which doctor does it so I can look out for him?
I don't think they're in. I think everybody's pretty good with their reports, actually.
Yeah, I'm just
Okay.
saying. Just don't.
If they are slacking on their reports, let me know.
Mostly like what I do is like while they're doing the whatever they're doing, I'll take notes for them, and then that helps them write their reports just in case, because I know they're like doing all the stuff, the doctor things and whatever. This bed is really soft.
They are quite nice, aren't they? But yeah, so most of your work as a nurse, and this goes for you too. It's going to be prep work. So you're going to be making sure that IVs are all good. You're going to be making sure that you've got the correct blood. You're making sure that everything is all hunky dory when it comes to fluids and oxygen and getting prepped for surgery. And then the doctors will come in. They'll do the surgery and whatnot. And then you'll probably be the ones that end up tidying up the patient and stitching them up at the end of it.
Okay, cool.
For me, as a doctor and a surgeon, I want you to have a lot of hands-on time as well. When we did a lung transplant with Dr. Bauer, and yeah, she was fantastic, very very helpful, and I couldn't have done it without her.
Lung transplant, eh?
Lung transplant was very interesting. Yeah.
Watch out! I don't want to kick you when I get up.
Okay. Do we have any questions about gunshots?
No, I think I'm good.
I do.
Yes.
Administering morphine.
Oh my gosh.
Okay. So,
That is one that I've had trouble with.
if a patient asks for morphine, don't give it to them. It's a really good rule of thumb. We will get a lot of opiate addicts coming in. If they ask for it, there's a good chance they want it.
Okay, good to know.
So we have
And then-
plenty of other medications that we can give that are non-opioid. They are pain relief.
yeah, as far as opioid uh, painkillers go, um, typically people that have concussions, I try not to prescribe any opioid pain
Mhm.
relievers to, just for the simple fact that I don't want them to become drowsy. So I'll typically just give them an NSAID or something of that
Yes.
nature. Um, I had one patient that presented a concussion, but they also had some broken bone. I can't remember exactly what it was, but zygomatic arch is what it was. So it was
Okay.
painful. I treated them, and I let them know that I couldn't prescribe it right away. If they were still experiencing a lot of pain, to come back in later on, and we would revisit that.
Yeah, so with morphine, just because of the way that morphine works, if their patient has any sort of signs of altered states of consciousness due to a head injury, don't give them morphine. Just because of how it works, it can make things worse, and the last thing we want to do is, well, make things worse. So yeah, we can give them non-steroidal anti-inflammatories, which is NSAIDs, and they will help. There's plenty of options for that. Opiates are fantastic at pain relief. They are really good, but they are also incredibly addictive. And we do get all sorts of people coming in trying their luck to try and get morphine.
Good to
I
know.
do my best to avoid prescribing any
Yeah.
opioids if possible. I mean, if it's a injury that is going to have a lot of pain involved, I generally avoid morphine. If anything, it'll be a script for, uh, you know, hydrocodone or low dose codeine or something.
Mm-hmm.
But
Damn, Dolly
morphine,
really knows his
I've
stuff.
yet to administer to any patients because there's generally something accompanying that that would make it uh, more harm than good, to say the least.
Yeah. If they're going to be staying in and they're going to be able to be observed, you can give them morphine because they're in the right place. If there's any complications, they're in a hospital, so we can deal with it. The last thing we want is to be giving people morphine with head injuries and then popping them out the door because we don't know what's going to be going on once they leave.
And typically, that's what I'll see. They'll
Yeah.
check out on their own recognizance.
Elaina, did you have a question?
No. Pretty straightforward.
Awesome.
My
Yeah, we
roommate's
have loads
home.
of pain relief that we can give to patients. Okay, what other ones are you going to get regularly? Typically, I would say the most common two that you're going to get is going to be probably NVAs and gunshot wounds.
Welcome
I,
home, roomie. Yeah, she's here.
Oh, go on.
I've had a lot of concussions, so I feel that would be fruitful to go over.
Mm-hmm.
Hello. How was it today?
So there's not a huge amount that we can do with a concussion. It mainly comes down to monitoring. It depends on the severity of it as well. If there are signs of a concussion, we'll get them in for a CT scan. We'll make sure that everything is a-okay. Make sure that there's no sort of severe bleeding in the brain. If there is, then we have to deal with that accordingly, which can be dealt with in a myriad of different ways. As nurses, don't worry about that call for a consult, call for a doctor, prep them, and then hand off to them. They'll deal with that. Okay. So, surgery-wise, when there's a build-up of blood due to a bleed, it's going to be coming from. It's going to be released during what we'd call effectively drilling into the brain, not into the brain, into the skull to try and relieve pressure, not into the brain. Good lord.
That the name of that procedure on the tip of my tongue, but I can't remember anymore. A burr hole.
But yes, correct, burr hole. Or we can do a craniotomy. Which is where you remove part of the skull. So there's a couple of different methods. Sometimes, if you have a severe concussion, the best thing to do is really, if it's very severe and there is a bad traumatic brain injury, what we will tend to do is put the patient into a medically induced coma, just to try and reduce the amount of brain activity that's going on, and it allows the brain to heal as best we can. It also allows us to observe and monitor. If anything starts getting worse, we can then have interventions on that. Typically, your concussions are walk in, walk out, make sure everything is okay when they do. So CT scans, just make sure everything is good. Tell them to take it easy, make sure they don't go to sleep, so on and so forth. But yeah, once it gets to the more severe stuff, they might be unconscious. They might have severe, they may be deteriorating while they are here. We would then put them into a medically induced coma, particularly if they are already unconscious. Typically, EMS will bring them in, and they'll say, "Hi, we've got a patient here. They've been involved in usually an MVA or a fall of some sort. They're showing signs of concussion." We will always double check that, though. Don't always take their word for it, because obviously there are many different things that can present similarly to a concussion. We want to double check.
Oh,
to make
hi
sure
Lux,
everything
how
is
you
good.
doing?
So we'll get them in for a CT scan, just make sure everything is good and make sure there's nothing untoward. Because what we could find as well is that we have a patient that's come in and is deteriorating. So they're not too bad when they come in, but they may have had some form of hemorrhage, be it subcranial or intercranial. There is a brain bleed going on, and it is potentially getting progressively worse. So we might find that they deteriorate while they're in our care. They've been potentially okay in the ambulance, and we need to be prepared for that. So we get them in for scans, we make sure everything's okay, and then treat accordingly. As I said, most of the time we get walk in, walk out, or EMS in and then walk out.
On break at work? Hell
Or
yeah.
we get EMS in and then police out if they're on a police hold.
Gotcha.
Dr. Campbell, this is an extra step I've been doing, but do you recommend preliminary pen light tests as well as simple cognitive questions?
Yeah, absolutely. Yeah, so typically EMS will on scene, they'll have already done a pen light test just to make sure that they know what they're looking for. PEARL is the acronym you want to be looking for. Pupils, equal, and reactive to light. PEARL. So we shine the pen light in each pupil, and we want to make sure that the pupils are constricting evenly, so the left at the same rate as the right. A good indicator, not always an indicator of concussion, but it is a good indicator. If one is slightly slower than the other, or one is very obviously non-reactive, sometimes if it's a really bad concussion, we may find that one pupil is completely blown out, which means that it's just really, really dilated on one side and almost not reactive to light at all. Then we know that we've got something serious going on. But yeah, like Dr. Simon says, we've got we can do preliminary questions. We can ask them questions. You know, what sort of when to ascertain whether they're alert and oriented, seeing if they know what time of the day, know what time of day it is, know what day of the week it is, what month, season, whatever you choose to do, as long as they're awake and with it.
All right.
We should make that kind of like a little daily slogan thing, like Dr. Simon says. You know?
Oh my gosh.
Oh, I don't know anywhere near enough to have that as a daily slogan.
Well, I'm just saying, like, Simon says.
I've had that a lot already.
I'm sorry.
That and the twins thing with me and Dr. King.
Oh.
Oh, is that still going on?
Yep.
Great.
Every time. I've embraced it at this point. I mean, it's a little game we can play.
Just confuse people now and again. Just swap things around.
Oh, we've done that.
Excellent. Good.
We had a trooper come in, and he came in to ask a question, and I answered it, and there was a follow-up thing, so I walked to the back, and Dr. King came out, answered that question. There was another follow-up, so he walked back, I came back out. It was a solid 15 minutes of doing that, and he thought he was going
Perfect.
crazy.
Oh my god.
Sometimes you have to have fun here. It can get a bit.
I was going to say,
mundane.
if you can't have a little bit of fun at the hospital, where can you? Hospitals aren't always gloomy, depressing places. Because obviously we want patients to come in happy and, well, as happy as we can, and leave happy as well. So, having a little bit of fun, nice bit of chit chat as well. Honestly, the biggest thing for you guys is going to be your patients and how you interact with them, how you talk to them. Some of them are going to be coming in scared. You're often going to be seeing patients on the worst days. They are experiencing potentially the worst day of their life. So if you can be nice, caring, kind, and empathetic to them, they will remember that.
Oh, yeah, that's most of the reason why I wanted to do this, just to make people feel better.
Mm-hmm.
It's arguably as important as the actual work you do as a nurse or a doctor.
Who knows? You can have someone that hates hospitals come in, and you can be the reason that they don't feel so bad about it anymore.
Mm-hmm.
Yeah.
That happened? We could though.
They're not dead yet. They might not be when we get there.
Not quite, but I hope one day it will.
I feel kind of naked. I'm the only one without a stethoscope.
You can go and grab a stethoscope if you want.
I should get one. I'll go get one.
So, Dr. King, what's the wildest thing you've seen so far? Or Simon's, whatever.
Doctor, oh,
Uh,
I've had a full ER before. That was a bit exciting.
wow. Were you by yourself?
I no, I had someone with me here to assist, but you know, it can get a little stressful at times, but you know, once you do everything, once you do your job, it's a lot more rewarding.
Does this look weird to you? I feel like it looks weird.
What looks weird about it? Looks okay.
It's good, good. Okay, never mind.
That's fine.
There's a couple to choose from.
I think this was the second one. Oh no, let me look again.
There's one almost at the other end of the rack.
Yeah, that's what this one is.
Is that the start or the end of the rack?
The end.
Okay, yeah, there should be one near the start as well. In the one near the start, you can colour. There's different colour options.
Yes.
There's a pink one.
There is a pink one.
Oh god.
You feeling a little less nervous about the job now, Nurse Reyes?
A little bit. I think once I like get the first patient out of the way, it might feel better.
I think, yeah, once you get the first couple under your belt, it almost becomes second nature to a degree.
Yeah.
What you'll find is that every time you get a new patient with a new presentation, you'll go, oh my god, I don't know what I'm doing. The trick is, we're trying to give you all the information that we can so that you can use your brain to deduce what it is that you need to be doing. So obviously, we can't train you for every single eventuality and every single patient that comes through those doors. It's just, otherwise your training will go on for decades.
Mm-hmm.
So we give you the most information that we can, because obviously the thing is, any penetrating wound, be it an animal bite, a stab wound, an impaling, a gunshot wound, they're all relatively the same. They're all categorized as penetrating wounds. So you can treat a stab wound like a gunshot. So it's still gone in and made damage, and you need to go in and clean it up, make sure everything's cauterized. Obviously, you won't be doing surgery yourself, but you'll be assisting with it. So you'll be helping the doctors, making sure everything's good, prepping them for surgery, and then sending them off for surgery. So it's one of those things where once you've done one sort of penetrating wound, pretty much they're all the same, kind of.
Okay.
Same for MBAs. A lot of people, and broken bones, really. Obviously, some broken bones are a little bit more complicated. If you have a really bad fracture, then obviously they need surgery, they need pins and rods and whatnot. But again, that's where you hand it off to the doctors and go, that's your problem now.
Gotcha. Okay.
So your main role is going to be making sure that the patient is okay and prepped for surgery.
Okay, I can do that.
You get the fun job of actually dealing with the patients.
Yeah. I mean, I like
I like
think I'm
the symptom
sociable.
better.
Nice. One of the reasons why you got hired on. You're very sociable and pleasant. So we want people with nice bedside manners. So honestly, just chat to people, see how they're doing, keep them calm, make sure they're okay. While you're prepping them, obviously, if you've got an unconscious patient, you can still chat to them. Some of them can still hear. They're not really with it, but they can still hear what's going on. So you can chat to them if you want to.
Okay.
Sometimes it helps as well. it helps go through your process as well. You're like, right, well, I'm just going to do a quick clean up here. We're going to do this, going to do that, and so on and so forth.
I always talk through what I'm doing. It kind of cuts through the quiet if there's any of it, you know. I mean, even if you don't have anything to say, you can still just be like, okay, I'm gonna check your heart rate. I'm gonna use my stethoscope to check your breathing, check how your lungs are sounding. It helps me a lot to get the quiet out, and it can also strike up a conversation because they'll be like, oh, why are you doing that? Why are you doing that? And
Gotcha. Okay. She's so quiet.
Okay, what else could we give you? Let's have a think.
A thunk.
Oh, actually, blood donations.
Oh yeah, I've done a few of those.
Yeah. Okay, if you've done a few, do you want to take Elaina through what your process is for doing blood donations?
Okay. So usually we'll have them come over here and sit in one of these chairs. And
you can actually donate blood if you'd like.
oh my, live action.
I can do that.
I love it. It's like we're role playing or something. It's kind of fun.
Roleplay is a fantastic way of learning, particularly in hospital scenes and medical scenes, because, like I said, like we don't always get an opportunity to go into strong detail when it comes to patients. So roleplay is a fantastic way to get there, and it also means that we can take time to answer more specific questions about the patients that we have coming in, rather than having a patient come in who's critical and going, now what do I do in this situation, when actually we need to be just working on the patient.
Clear.
Yeah,
All right.
roleplay's great.
So, oops, sorry. Oh God, that's the chair. Okay. Oh there, sir. I hear you'd like to donate some blood today.
Yeah, I would love to donate some blood.
All right. Could I see your ID really quickly, please? Thank you. Thank you. All right. Now, do you know your blood type, or would you like that information disclosed to you today?
My blood type is B positive.
All right. Excellent. Excellent. All right. So, Nurse Elaine over here is gonna be taking your blood today, and
Take my
I will
blood?
be here. Yes, she's taking it. No, you're donating blood, right? Uh-oh.
Alright, we'll do that.
Well,
in a second.
maybe later. Hello.
Right, let me just get the stretcher over here.
Right, went down to Burger Shot, got you guys some lunch.
That's okay.
Oh my god.
Don't
who am I
actually
handing
eat
her
it,
off
though.
to?
You can hand her off to me.
Okay.
Go team.
what's going
So
on?
we found her in the road. She had a bloody nose, and we put a C-collar and O2 mask on her. When I cleaned up her nose, it kind of felt like a little offset, so you might want to check out and see if that's broken. She's been unconscious this whole time, so I haven't gotten a chance to talk to her at all and see what happened.
Alright.
Al-
We will see what we can do.
Also, just for
She-
reference, tried to start an IV on her. Her veins are a little shoddy. Not great.
Okay.
Look like they have probably been overused.
Oh.
Gotcha. Okay. We will see what we can do. Thank you.
Okay. Yeah, and she's not on a police hold or anything.
Okay.
Nope, just big napping.
Thank you, guys.
No
Thank you.
problem.
Hello, can you hear me at all?
Oh my god, what is that? Fuck.
Vitals. I'm gonna start you on some oxygen, okay? I'm also gonna see if we can get an IV in here.
Oh God.
Okay, so we have. I can't really get a vein here.
Okay, so we have a couple of options when it comes to assessing or accessing sort of veins or I guess just fluid access. We can either do intravenous, which is going to be into a vein either in the arm, hand, or foot, but we can also do what's called intraosseous, which is into a bone. We have a little drill kit for it, and it typically will go either into the shin bone or into the shoulder. So we'll pick our little point on the shoulder. If we cannot get a vein, it's obviously a last resort, but if they desperately need fluids, we drill into the shoulder, drills the needle into the bone, and then we will hook up. Same way we would hook up an IV line, we'll hook up the IO.
I'm gonna check the foot here to see if
Mhm.
there's anything.
Rain that's always honk.
So what Dr. Simons is, I mean, I'm sure you've had blood taken before, but obviously what Dr. Simons is doing now is he's just trying to constrict the blood flow just to make those veins pop a little bit. It just helps with trying to ascertain where they are, and hopefully we can get a needle in there and get some blood going, or other fluids.
Okay, so we got a vein on the foot. I'm gonna start her on a normal saline solution.
Fab.
Oh no.
Now we're on step 2. We're gonna check for any visible injuries here. See what we can find. I know they said that the nose was a little bit misaligned.
So when we have an unconscious patient, we're looking for, and we're looking carefully because we want to be checking vitals. That's going to give us an indication of what's going on. If there's anything serious going on underlying, we can check that through vitals. But obviously a good physical inspection is going to tell us an awful lot.
Okay, so we have a bloody nose, a split lip here. Looks like they have some injuries to the knees. And we have a swollen eye. Okay. So as for the nose, I think what we're gonna do is we're gonna get an X-ray on that. Let's take a look at the eye here. Since there was some trauma to the face, I am going to want to probably do a CT just to check for any injuries to the brain, see if there's any swelling or bleeding in there.
Valeria, that's a big word.
Looks there's bleeding on the outer area of her eye.
Okay.
Okay. So what we're gonna do is we're gonna get some scans done.
I'm getting Walking Dead
I want to
vibes.
make sure there's no really bad underlying condition here, and then we'll go and get those wounds cleaned up. If the nose is pretty badly misaligned, we can set that while they're still unconscious. And
How's the
then,
breathing? How's the patient's breathing?
their vitals are depressed, but I do have them on moderate oxygen.
Fab.
Why is she doing that? She's like twitching. It's bothering me.
Okay, nurses, let's get them back to imaging. Let's get a CT of the cranium. Let's check the nose and let's check the brain to see if there is any underlying issues there. As far as that bleeding is concerned, I'm thinking that if there is no issues found in the scans, it's most likely just due to trauma, just some collection of blood under the eye.
Yeah. Yeah, broken blood vessels in the eye typically look worse than they actually are.
Ah!
Okay, so while they were getting her prepped, it looks like they did have some bruising present on the torso. While she's back there, can we get some scans of the torso as well to check for any broken ribs?
Okay, that's what I was wondering. Alright, cool.
Okay, so we got scans back. All right. So it looks like we do have a fracture of the orbital bone. Doesn't look like surgical intervention is going to be needed. We will need to have that iced. Probably gonna need some decongestants as well going forward. Um, of the torso, we have 3 broken ribs. One looks like it could possibly end up puncturing a lung, which is not good. We probably need to get that put into place. Dr. Campbell, would you recommend having that pinned?
So with ribs, just the way that they are, there's not a lot we can really do with them. We could pin it, but it depends on how badly it is broken, obviously, because of the strength of the muscles that are around it. If we can just set it as best we can, the muscles surrounding the ribs as well, the intercostal muscles and whatnot, should actually hold the rib in place pretty well, and it's just a case of healing it up as best as it can. But again, it depends entirely on the severity of the break.
So it looks like it's a few fractures. One is kind of turned a little inwards, could possibly end up puncturing a lung. So you'd recommend setting?
Yeah.
We'll get that rib set. It looks like on medical history, we have a prior visit for overdose on opiates. So opiates are most likely going to be a no-no here. Patient is Hep C positive with a minor cirrhosis of the liver.
Okay.
Okay, so nurses, we're gonna get that rib set, and then for the superficial wounds, we're gonna get those cleaned, irrigated, and covered up. We'll apply some topical antibiotics to the knees, seeing as if there is fibry present, we don't want to get an infection on that. And then we will get that orbital socket iced, and when she wakes up, we will let her know that she's most likely going to need a decongestant. Let's go ahead and get that rib set really quick, and then you guys will be able to have at it. Like it should stay there. Beautiful.
The problem that we have with ribs is because they're always moving when breathing. It's really difficult to do anything really with them. The last thing we want is to be making things worse, but they are fickle little things, our ribs. They can splinter off, so we just want to make sure that they are as stable as they can. But yeah, some very, very strong muscles around the ribs, so yeah, holds them in place quite nicely.
Damn, she got in a fight or some shit. Whoops, I wanted to pull that up.
so we don't have any excess blood going on or anything here. Okay, nurses, if you would like to get the wounds cleaned, saline, gauze, antibiotic. Make sure you check the lip, the knees, and that orbital socket will need to be iced. Check for any additional wounds, and this patient should be okay.
Nurse Blackwell?
What was that? Sorry. Why am I standing like this?
Wanna help me clean the wounds with saline, gauze, and antibiotics?
Oh yeah.
Oops.
So once the patient is all cleaned up and everything is good, we'll pop them back into the ward and get them all ready for recovery, and then we can monitor them and make sure everything is a-okay. Then they're going to be ready to go as and when they're fit and well.
Motherfucker.
Ma'am.
Oh hey there. Don't worry. You're in
Who are
the
you?
hospital. My name's Nurse Blackwell. You're in the hospital at Pillbox Medical. This is Nurse Elaine, and that's Dr. Simons. And you've been, looks like, run over by a car.
What? Why are you touching me?
We're just cleaning some of your wounds. You got pretty banged up out there. Just making sure you don't get any infections or anything like that.
No. No, I'm okay. I'm fine. What did you do?
And please do be careful too. You do have an IV in your foot.
IED?
No, like an IV, like a saline solution, to help get fluids back into your body.
Oh. No, I don't need that.
Oh,
It's just there to help you. Please
oh
don't
wait,
pull that out.
no, wait. Hold on. We can remove that for you if you want, but don't pull it out, okay?
No, it's okay.
It's almost done. Just let it do its thing.
No, okay, hold on. Before you go yanking, we're gonna have to do more stuff to you if you go yanking it out, okay?
No, touch me. I'll punch you.
Well, then don't yank it out so we don't have to, okay?
Punch you.
Please don't punch me. How are you feeling? What were you doing out there? What happened?
It's Kaz.
Wanted to go down to the city. Get money.
So you're trying to make money?
There's no pawn shops in Sandy.
Oh, so you're visiting down here then?
Yeah.
Okay, all right. Well,
Don't remember coming down, but I know I was gonna.
Well, you did make your way down here to us, and we're here to help you. So if you can just let the nurses finish helping you out.
No, I'm okay. Okay. I need a drink. Head hurts.
That IV is giving you all the fluids you need right now.
yeah. It's like speed running the drink.
Also,
Yeah.
if you'd like, we can get you a glass of water once they're done finishing cleaning your wounds.
If you want something to chew on, we can get you some ice chips.
No. I think I'm good to go. I think I can go. I gotta get to the pawn shop.
Well, let us finish, because if you don't let us clean your wounds, you're gonna end up back here because you could get infected, and that's gonna hurt more.
I'm tough.
I understand if you do want to leave, and we can't force you to stay here, but it is in our best recommendation for you to at least let us get you cleaned up.
No. Where are my shoes?
Hold on. All right. It looks like the bag's done. Let me just take that out really slowly. Hold on.
Just Blackwell.
Did you steal my shoes?
Nope.
Where are my shoes?
There you go. All done.
Shoes. Where are my shoes?
Shoes
Mm,
should
over here.
be with your possessions. patients.
Damn.
Ma'am, we have your shoes right over here.
Mm.
Yep,
Over
they're
here.
right this way.
Over here.
There we go. There are your shoes, ma'am.
I ain't paying.
No, it's all state paid.
Good.
Stay safe out there.
Why is she walking like that?
Ma'am, if you do get a chance, make sure you ice your face, okay?
Mm.
Okay.
Well, that was
Well then.
something.
Great job, by the way,
Yup.
while you had the time.
Who, me? What?
I'm gonna go
Both
ahead
of
and
you.
start on
Oh,
this
okay.
report.
Yeah. So, have you done any reports so far?
Mm-mm.
No. Okie dokie. So, you should have access to the database.
Yeah, if you'd like to have one of them do it, I got them a patient profile started.
Perfect.
So they are in there under Lorraine Colfax.
Okay, so Elaina, you've never done a report before, have you?
No. No, I have not.
Okie dokie. Are you familiar? Are you all set up? Have you been on to our database before?
Kinda. I've snooped around a little bit, but that's it.
Okay, that's fine. No, that's absolutely fine. It's a good way to learn. Go have a look through reports and whatnot, and it's a very good way to learn. So let's bring that. So we'll bring that up.
You said you started her on a profile?
I was in the middle of
I
talking.
offer
You just walked
one
away.
piece of advice very quickly.
I thought you would keep talking when
Yes.
you came out here.
Yes.
So you don't want to meet them.
Blackwell.
Yes.
Come over closer over here real quick.
Oh, look, they don't want to meet
Make
us.
sure that you wear gloves when you're doing any procedure. Especially in the case that it's more for your protection than anything. The patient was Hep C positive and you were dealing with a needle that was inside them. So just be very careful.
Just gonna go wash my hands 7 times really quick.
Does she have a profile with us? A patient profile?
I I did start them on. You can look them up under Lorraine Colfax, or if I remember correctly, it's 8379.
So on our database, if you go to reports,
Oh, reports. Hi, Adder.
and we can walk you through it. So if you go to reports,
Uh-huh.
yep, you there?
Yep.
Okay, so we will go to create a report. And you'll get a couple of boxes pop up. You're going to have patient, and you can click on that drop down menu. You can put in Colfax, and Lorraine Colfax will pop up there. You can click that. Then I personally tend to use, you'll see sort of 2 boxes below, which is going to be content. And then right down at the bottom right of those 2 boxes, there's Markdown and WYSIWYG. I tend to use the what you see is what you get box.
Okay.
Obviously, everybody does it differently, but I just prefer that one. So in there, we will put patient name, which is, we are going to be replacing the square bracket, so everything gets removed. So we go patient name, which is going to be Lorraine Colfax. Admission type is going to be what she came in with, so we suspect it was an MVA, and then the date.
Feel better?
I kind of.
It happens.
Yeah, but I should have paid attention.
Yeah, Cass, thank you so much for giving us something to do. I don't know the paramedics' names. Unfortunately, I didn't introduce myself.
Okay, so you're going to have Vance, so J Vance and E Davis. Are you set up for the radio? With Pillbox.
I'm set up, but not currently there.
That's fine. So we're looking at E Davies and J Vance. There we go.
Hi, Lux.
So all the entries are relatively straightforward there. Obviously, patient assessment, condition and diagnosis is what happened when they came in, what they presented with. Treatment provided is obviously what everybody here did. And then discharge and follow-up information is either, whether they are in recovery, if they're in ICU, or whether they've left, whether they left without treatment or left against medical advice, and so on and so forth. Also, what if we gave them any medication or anything like that?
Okay. No, thank you for that, Kaz. That was awesome. I knew it was you the minute you started talking. I was like, it's Kaz! Ah, it's Kaz! If I send this in and you guys look at it, you can edit it, right? And put in what I missed?
Yeah, yes, we
Okay,
can.
good.
Yep.
Yeah.
Good, good.
yeah, if you let me know or you let us know when it's gone through, we'll have a look and see what's what with it.
Okay, cool. Yeah. The real nurse experience. How are you liking so far? Okay, this is doing a report is not fun, but it's kind of fun, honestly. Shit, she's broke. Okay. Done.
Okey-dokey. So what you can do is, if at the top of the database you can click on patients, you can look up and see your handiwork. We can either look up via patient or we can look it up via the report. It's entirely up to you. So if I search through the reports, I can look up, I can search for Colfax. I can now see patient is Lorraine Colfax, author is Elaina Reyes. And we've got date and time. And then if we click on details, it'll bring up the entire report.
Oh, okay, cool.
Yep, I'm looking at it right now.
This is so cool. This website's so well done.
That looks good to me. Only thing I would edit is MVA, as in motor vehicle accident, rather than NVA.
Yeah, that's the only thing I saw. The tree with ride looks pretty detailed. Looks good.
Yeah. Good job.
Thank you.
Oh, first Blackwell.
Yes. What?
Let me say what's up.
Oh, I don't know. I was wanting to know if, well, I might head out soon just because I got some emails to write, stuff like that.
Yeah, no, that's fine. Did you have anything further for Nurse Blackwell, Dr. Campbell?
No, I don't. I think you're doing fantastic. Have you been enjoying your time working here and getting patient interactions? That's fantastic. If you've got any questions for us, again, you can either ask us when we're here, or you can catch us via email, or you can have a chat to us or ask questions in our little chat room thingy.
Oh, yeah. Yeah, it's been really fun.
Awesome.
Okay,
I'm
well,
very happy with how you guys have done today.
thank you.
I'm also going to head out, but you guys are more than welcome to stick around. In capable hands of Dr. Zimmerman's here. You can shadow him and support him and help him out where needed.
Okay.
Yeah?
Yeah.
Okay.
Totally up to you guys.
Awesome.
I'm here as long as you want.
Hmm. Yeah. I don't know. I really probably should go send those emails. I would stay, but yeah.
No, you're absolutely
Right
fine.
ahead.
You've got things to do. You crack on.
Hey, perfect. Well, it was great. Like, I mean, I haven't been in here in a while.
Short
but it was
shift,
nice to see you
quiet
guys.
shift, but yes.
Yeah.
I mean, he did get some action, which was great, you know. One
Exactly.
patient is better than no patients.
Exactly. I'll try and work on getting that treatment guide all sorted up and ready this week, so that we're all finished up. I've just been awfully busy recently.
All good.
Okie dokie. Right, well, enjoy the rest of your shift, however long you stay around for. Hopefully you get some patience. If not, we can always run through scenarios.
For sure.
Right, I'm going to give you a drink. Take care,
Thank
guys.
you.
Have a good
Bye.
night.
Take care, Dr. Campbell. Thank you.
Cheerio. I know I want Cheerios.
Oh shit.
Yeah, stay as long as you guys want. If you have any questions, we can do more scenarios. That's totally fine. Whatever you guys want to do.
Oh. Why are these like so weird? Sure, I forgot the best one for her. No, we're not stealing drugs. Gangster walk?
Are you okay over there?
Yeah. Just getting out some nervous energy.
Understandably. So, did you have any other questions? Did you want to walk through anything? There are a couple things that I can think of that might be beneficial for you. I don't know if you don't want to overload yourself with any extra info. It's totally up to you.
Hit me with it, why not?
Okay.
Oh.
We don't have to talk about it out here in the lobby. Okay. Blood donations. Very simple thing to go over, but you probably will do them quite often. So, a blood donation. It's pretty simple and straightforward. You get the patient's ID. If their blood type is on file, then you don't have to send it in for testing. If they know their blood type, that's also good. I would make sure you'd send it to the lab and check. But in terms of actually doing blood, you will get your gloves. You'll get a donation kit. Basically, it includes a alcohol prep wipe, tourniquet, sterile needle, and collection bag. Do you know how much blood is donated in a donation?
Mm-hmm. No, just tell me because I don't know.
It's okay. So it's 1 pint. 1 pint is donated at blood donation.
Okay.
Yep. So a person normally has 10 pints of blood. 1 pint is given during donations. People can donate every 8 weeks ish, but really how time goes here, I say about every week is sufficeable. So what you want to do is you have them choose their arm. if you want, you can actually do it. If you want to go get a test or a donation kit and your gloves, and we can run through it.
Okay. Ah, I never spell.
Okay. So for scenario's sake, we'll do it on my right arm. So have the patient roll up their sleeve if they have a long sleeve on, and then what you want to do is you want to wipe the inside of their elbow where their vein is, and then you'll tourniquet the arm, get the vein, and then insert the needle gently. And then you will attach that to donation bag. And if they need to, you can always have, like a stress ball handy or something. They can squeeze it a few times and it'll generally give you a better idea of where the vein is.
Do you need one of those, or?
No, I do not. I mean, you can tell.
I know, but, I've heard of doctors who are afraid of needles, so.
I would not be one of them.
Okay, I'm going to insert the needle now. You're going to feel a prick.
Yep, and you can either give them a countdown. I mean, I generally just be like, hey, do you want a 3, 2, 1, or are you okay with me just going ahead and doing it?
Do you
Entirely
need
depends upon the person.
Would you like
No,
a 3
no,
count?
just go ahead. Sometimes people ask you to count from 10 or something outrageous like that, but
Oh my god.
just do whatever makes them comfortable.
Oh, I did
Okay.
carefully twice.
And then you can remove the tourniquet. Blood should start flowing into the bag, and we wait until it's filled up with a pint. And then what you'll do is you'll get a gauze pad. You will place it over the site, remove the needle, cover it carefully, and then you'll wrap it up. Let them know they may feel woozy or lightheaded when they stand up first. Offer them a cookie, and they should be good to go. No need to file a report or anything on it. And you just bring it back to the lab.
Okay. All right. uh.
Like I said, they may feel lightheaded since they did lose a tenth of their blood, but generally they will be okay. Have them stay seated for a little bit if they need to. Offer a cookie, but otherwise, you did great. Get that back to the lab for storage.
Can you show me where the lab is again?
Yeah, it's just right there. Right through that door.
I cannot spell.
They'll usually just come to the door.
Come to the door. Okay, well, he said come to the door.
Okay. And then, how do you feel about that? Not too bad, right?
Not too bad.
Cool. And then concussions, you'll get those a lot. Really, best way to check is with a pen light, see pupil reactivity. If they constrict and dilate normally, they don't have a concussion. If there's anything basically out of the norm, it's a good chance they do. That's when you'll ask them, do you know what day it is? Well, asking what day it is not the best way. Usually I'll ask them, do you know what state you're in? Do you know where you are? Do you know your name? Stuff like that. Basic questions that they can answer if they're not confused.
Okay.
If they can't answer any of those questions correctly, then you will want to get them back to CT. That'll check for any brain bleeds or swelling of the brain, which will confirm there is anything worse than a minor concussion. Which then from there, like Dr. Campbell said, they may need to have burr holes or something of that nature done. But otherwise, there's not a lot you can do about concussions. Make sure you don't give them any opiates. You'll give them basically a IV acetaminophen, which is a NSAID, non-steroidal anti-inflammatory drug. It's basically just a pain reliever that doesn't have any sedative properties to it.
Gotcha.
But if they decide they want to leave, make sure they don't put any strain on their eyes. Stay away from screens, any exertion, stuff like that, and don't fall asleep.
Okay.
There's not a ton that can be done for minor concussions, but it's good to know if they have one.
Yeah, understandable.
Any questions so far? Do you have anything you want to learn? Do you have any questions about just general stuff in the hospital?
I mean, everything seems pretty straightforward.
And for the most part, it is.
Brain gone burr. Yep, it has.
Have you done ice contacts? Have you set up patient files?
No.
Okay. We can do that.
He walks like Kevin. Hello, Bug. Hello. Okay, we're not walking like that. I don't like that.
You can go behind the counter if you want.
Oh, are we setting up yours?
You can set up a file for me, yeah. Alright, so same place as writing the reports, but you'll go to the patients section instead of the report section. Let me know when you're there.
Just walk like a doctor. Easy. I wish. Okay. Do you have any known allergies?
Okay. Oh, so you're already creating it?
Yeah, your name's already here.
Oh, my
Bug,
name there?
thank you for the gift sub. Well, I mean, it says create patient file, and then I put your name in the file. You're right. What's your ID number?
Oh, okay, I am. I'm under people. I'm not as a patient. Okay. Yeah. So generally, when you first start a new patient, it'll ask for their ID number, their first and last name, their phone number, stuff like that. But if you want, if we're just gonna fill out the new stuff for patients, I do not have any known allergies.
You said your blood type was B positive, right?
B positive. Yep.
And you're healthy.
I would like to think so. Yeah.
Okay, okay. Emergency contacts?
I have none.
Alright, no judgment, cause same. Okay, are you an organ donor?
Yes, I am.
Okay, then you're done.
Yep. And in the notes section, if you ever have something like, if they, okay, for instance, the patient we had, they are positive for hepatitis C and they have cirrhosis of the liver. So once you finish up my profile, you can go back to patients and you can look them up and you can see the notes I put in there. Those are examples of notes you want to put in on a patient if you get information like that.
Gotcha. Okay, good to know.
Basically, it's just stuff that's good to know for a doctor, especially something like Hep C. They need to be a lot more careful with needles because if they poke a patient and they get poked with it, that is not good.
Gotcha.
Pretty high probability that they can contract that disease as well, and we don't want to have doctors, or really anyone for that matter, that contracts that.
Yeah, good to know.
But yeah, patient files are very straightforward to do, but you will be working with them quite a bit if you're doing any ICE contact updating. It's all done through patients. You would look up the person. If they're on there already, you would just go in and edit. If they are not, you would create new and then see if their name is on there. If it is, and it would autofill everything that's under their people, which mostly it's going to be under a patient already, but if you need to create a new file, then you would just ask them their ID number, first and last name, their phone number, date of birth, allergies, blood type, stuff like that.
Gotcha. Okay, cool.
And if they don't know their blood type, you could basically the same routine as a blood donation. However, you would just take a small vial and have that tested, and then you would just go back to them, pull up your tablet, and check the results.
Sick. All right, cool.
Yep. A lot of info, I know. But if you remember one or two things from everything today, we'll consider that a win.
I mean, I remember the website, so there's that.
Well, that's one thing, so today's already a win.
Awesome. Yeah. First day was not that bad, honestly.
Yeah, it's a lot more intimidating when you're thinking about going into work than when you're actually there, to be honest.
Yeah, understandable.
Yeah, and then you get there and you're like, oh, wow, what was I nervous for?
Yeah, I mean, I'm still pretty fucking nervous, but
And you'll be fine.
she swore. Fuck. No.
So where did you study? Like, what's your backstory?
You mean?
Nice.
Yeah. What about
Did
you?
you grow up in Maine?
No, not really.
Okay. I was born and raised in Arizona, and I went to Arizona State University, medical school at Arizona State University through the Mayo Clinic.
Oh, that's sick.
Yep.
Just do doctor shit during AU hours, and you'll
I
get
worked
past the
there
good
for a
shot
while
for
and
people.
then
True.
transferred out here.
What made you come here?
I like the beach.
Just the beach? That's why you came here?
Oh, I mean, yeah. I mean, it's not a far move from Arizona to San Andreas, really.
I mean, I guess.
I mean, people move from here to there all the time, you know? I just thought it would be a good move for me. And
Yeah.
there's a good hospital here, and I like the place. I like
Hello,
my
Belling.
colleagues so far, from the ones I've met at least, so it's all seemed to work out.
Yeah.
And you, how are you liking the job so far in your first hour you've been here?
Pretty good. I mean, I've only met one person so far in the city, so there's that. Besides now my coworkers. So I can't really say much about the people, because I don't really know that much, but the places that I've seen are pretty cool.
I spend most of my time at work, so I mean, I meet people that come in here, but otherwise, I mean, I've driven around a little bit, but otherwise, this is pretty much my home.
Is there anybody I should look out for, patient-wise?
No, not to my knowledge at this point, no.
Okay, good.
I mean, you'll learn through your own experience who is easier to deal with, who is not as easy to deal with. It just comes with the experience.
Okay. I'm just wondering if there's a particularly difficult patient I should call for backup for or something.
If you know they're difficult, you'll know right off the bat, and you'll be able to call someone.
Okay. Cool. Hospitals.
If you want to hang around for a while, feel free. I don't have anywhere to be, but if you ever want to just head out, let me know, and you'll be good to head out.
Yeah, I gave him the opportunity to say something funny, and he didn't. And I was like, okay, we're taking it dead serious right now. She's a regular. I have to watch out for that medic Adam Shelby. He encourages people to get hurt. I mean, she'll understand soon enough. True. We love people getting hurt. So get Kelsey hurt tonight? No, I'm gotta go to Arya. Don't do that. I'm pretty sure I'm about to go to Arya. Don't do that. Rose! Welcome to the chat. How you doing? Good to see you guys. The more blood and panic, the better. IB. Uh-oh. Let's log out of Pillbox. What? LJ, thank you for the follow. Appreciate it. She literally has one contact. It's Leon Dawes, and it says mechanic in the corner. Okay. Leon's a really old character. He's been around for forever. I think I might as well just go home.
It does seem to be a quiet night.
Yeah, not much going on. Just gonna go.
Okay.
Do my stuff. He owns Sideways. Yeah, he does. Off duty, and I gotta write it down. Damn, Melon. Savage. The one in Toledo, yeah. Alright, Elaina, hold on. Wait. Oh, that's so different from... I...
Heading out for the night?
Yep, probably.
Okay. Well, if you have any questions or anything, feel free to reach out via email or here, let me give you my card as well.
Okay, cool. Thank you.
Yep. Feel free to reach out and I would be happy to answer any questions you have. I mean, as well as, you know, obviously Dr. Campbell, but if anyone's not available, I'd be happy to help.
Okay. Oh, wow. Alright, shift S. Let me go make sure his number's right. I almost wrote Arya. That would have been so bad. Fail. Minus 100. Alright, well, I will probably see you soon.
You have a great evening, Miss Reyes.
You too, Mr. Simons. It's Simmons, but I'm gonna say Simons until he corrects me. Oh, that is not the way out. We're just gonna pretend that is, and we're just gonna F8 quit right here. There we go. Okay, let's load up our girl here. Maybe I should get a new character rolled up that could be a tinker or mechanic. Ooh, that'd be cool. Yeah, EU is hard. Character list with only 2 people on it. That looked weird. Yeah, I'm trying not to make a fuck ton of characters. Hold on, hold on. Oh, thank you. I probably might have not noticed that at all. Oh shit, no, don't punch. Maybe 4. There's a bunch I made that either. played once or had plans for but never actually went through and then never did anything with. Yeah, that's understandable. I can't play him because he's dead at all. Oh. Okay, so I know where I'm taking Arya. I kind of went deep. So we're gonna go inside. Have a great night, Jakers. Thank you for coming. Congratulations on your new badge. Oh, lock the door, please. And he finally made it home. So keep Kelsey inside for a month longer? Got it. What do you mean? Oh yeah, my title still says Elaina. You're right, thank you. I know where I'm taking Arya. It's not... Let me just make up a title on the spot. She was just out whenever I... I saw the bloody knife screenshot with the cops. Oh god, that is terrifying. I need to redo scenes too, but that's something I don't have right now. Understandable. Oh no! I fixed it, I fixed it. I just got a DM because I put 24-0 and then accidentally. Did you edit the title for stream? I did. Did it not save? It saved. Okay, good. Quick refreshing, good. Okay, good. Yeah, so I wrote something that I wanted to get an Arya's character today, and before I went to dinner with my boss and everything, I sat down and I started writing, and I know exactly what I'm taking Arya down right now, and we'll see what happens when she talks to Jimmy right now, but yeah. Listen, I didn't realize my mistake. Yeah, Arya saw him and she goes, oh damn, Adam Shelby's in the house and he has pink highlights. Okay, Araya's gonna wear something a little different because I know what I'm doing. Wow. He said wow. Oh, no balls. No balls. Make him bald. You won't. Ma'am, please exit the property immediately. I actually like your hair a lot. I'm just gonna let you stay. There's no competing with Shelby. Oh, Jesus, chat. Ah. Mercer. Okay, so I had an idea while I was driving, but I'm not gonna do it because I feel self-conscious doing it. What the fuck are we gonna do right now? Now you have to? No, I almost just did it, and that's why I was like, probably not. She just wants to see her goddamn man. She misses him. She hasn't seen Sam in 2 days. She hasn't seen Penny in 2 days. Since 2 days ago? It's been a day? Yeah, a day. She hasn't seen Jimmy in 4 days. 3 days. Yeah, she's fucking feels very alone. She hasn't seen Charlie. She's talked to Charlie on the phone, but hasn't seen her in forever. So, it's been a really long time, and she doesn't really know what to do. Mom's going through something, okay? No, I know she is, which is why Arya is not gonna say anything. She's just going down her own dark path too, so it's gonna be interesting. Maybe I'll post the writing thing tonight. Then you guys will know what I mean. Also, Shane, hello. I know that you appeared earlier, but hello. Nice to see you. Welcome. I missed you. So, Elaina has 8 grand to her name. And Arya, who I've been playing for 4 months. Fuck. Aw, shit, we lost money. I forgot about the Komoda. I knew you were focusing. Oh my god! Is that who I think it is?
Yeah, hi.
Hi. I missed you.
Thanks for taking care of me.
Of course.
What are you up to?
I was honestly just gonna go, see if I have laundry and then ransack or something.
Nice.
What are you up to? I completely forgot about
Selling
Jimmy.
crack.
Oh. Sick. Yeah. The Komoda cost me a lot of money yesterday. Oh, he's just selling her crack right now.
Bitch.
Okay, I'm gonna go check. I'll be right back.
Why doesn't anyone want to buy fucking crack?
I'll buy crack. Where'd you go? I completely forgot about Jimmy. Yeah. Jimmy doesn't even know anything that happened. Oh, John McDonald's. Hello? Mom's going through something, okay? Yeah, I know. Ah, shit.
What? Ow.
I was talking to myself.
What'd you say?
Nothing.
Oh,
I hit the button. Give me your bike.
What are you gonna do?
I was kind of thinking about, making money or something. I don't know.
Okay. How do you want to make money?
I don't know how I want to make money. How do you think we should make money?
Sure, I appreciate the respect.
Oh, excuse me.
It's up to you.
Not at all.
I gotta put this crap away if we're gonna go do something. Not this crap.
Oh,
this
I forgot to tell you. Wait, come here. Come here.
Let's go to your house. Hold on.
Oh, god damn it. I'm not good at running and talking, okay? Multitasking is hard.
Okay, what's up?
I got a license plate.
What do you mean?
I forgot you had a jug. Holy shit. There was a matte black penumbra chilling at Alta running, and Emma and I, we went up to it, got its plate just in case, and I have it written down.
Okay.
I don't know, it just makes it easier if we see it.
How do you know it was his though?
I don't, which is why, you know, at least it's something.
Yeah, I guess, yeah.
He just parked it and brought it back out again. Okay.
I gotta go to the bank. I need to deposit this.
And we're running again.
Okay. After paying my rent, I have 86,000.
How the fuck? Do you have that much?
Huh?
How the fuck do you have that much?
I bust my ass. There you go. You wanna go sell a car?
Haha, yeah I do. Oh my fucking god. I gotta change.
You wanna take my car?
Sure. Oh god, ow. Let me just change really quick.
Wait, do you want to take the jug or do you want to take the elegy?
Up to you, up to you. Oh god, ow.
I don't care. Which one? Which one?
Jug! Last time I really watched because the night she got it, she was around doing it yesterday. And then, she hasn't gone back to it, yeah, since yesterday. She kind of got distracted. I saw a clip of her in this and I was like, oh shit, we're wearing this today. Oh my god, you just scared the bejesus out of me. Okay, door's locked. Yeah, Cortez came to PDM yesterday. He's like, you have 2 days to sell a fucking car. And till Monday to sell 2 fucking cars. And Arya's like, sir, yes, sir.
Okay, let's go.
I'm going, I'm going. Arya's putting on such a mask right now so Jimmy doesn't know how, down she's spiraling. She's got whiskey on her that she's fucking sipping throughout the day. Why is she spiraling? Well... Yeah, but give him the tea. Give him the tea. Let's see if you can, She's not spiraling. Spiraling's kind of an exaggeration. She's kind of just dealing with a lot of, depreciating thoughts. Yeah. She kind of can't use mine against me? What do you mean? No, it's not.
I don't want to get us pulled over on the way over there.
Yeah, no, that'd be bad.
How the fuck is that? Does this car not have cruise control? What the fuck?
Yeah, no, it's not Kelsey that she's worried about. She knows that her and Kelsey are fine. She's worried about Kelsey because of Hector. Like, that's not... Yeah, no, I... Just start murdering some people. Oh, yeah, definitely.
Yeah, apparently it doesn't have cruise control stick.
Easy peasy. No, yeah. It's not really Kelsey. It's kind of just like... Yeah. Yeah. Exactly. Shane got it. She misses the fuck out of her friends right now. And some stuff happened with Penny. But that's meta and I don't want to give it out. So if Bug wants to DM Shane and tell him, that would be better.
Was that a cop? I'm not sure. And it's green light.
I was kind of looking down at my lap for a second. Sorry, I missed it. Look, we should get pizza. Those are the people looking for pizza. Did you see the tweet just now?
Yeah.
I ain't too worried right now. Arya's gonna be fine. She's fine. It's so bright, so bright. I love how she puts wee woo next to every cop's name. Hello.
Hey, question.
Yes.
Are you letting anyone test drive a very expensive car?
No. Why?
Okay. No, because I keep seeing a car like driving around here. It's like orange. I think it's T20.
Oh shit.
Yeah, so I didn't know if it was a test drive.
No, I don't have anyone. I just got here, so.
Oh, okay.
Yep. It ain't a test.
Oh.
Someone keeps driving around here? Like circling or what?
Yeah, I seen it like driving up Power and then cut into the alleyway. What is it? Just to the north of here. You know, that one that cuts across to Elgin.
Gotcha. Oh, if this is helpful, Cortez. If they're test vehicles, the first three of the plate says TST.
Okay. Okay, that's good to know. I didn't know that.
At least I'm pretty sure. I think.
Oh yeah, aren't they a specific color too? Now that I think about it, aren't they like red, like a black red?
It depends.
Okay.
The two test cars I drove were actually.
So yeah, maybe that.
When I test drove.
Okay. Yeah, I don't know. I thought it was weird, but I figured maybe they were test driving because they were in the area and it was like an expensive car.
Good looks.
Yeah.
Yeah, it's a orange T20. I think it's T20.
Yeah.
Alright.
If you see it, keep circling. Could you let us know?
Yeah. Yeah, I'll shoot you over a text or something.
All right.
I mean, I'm chilling down here, so.
Also, as to what I win if I sell two cars, like, is it like money or what are we talking?
Could do money.
All right. All
Yeah,
right.
I'll buy two cars right now.
Jimmy.
Oh shit. That's cheating.
That's cheating. It has to be somebody I don't know well. What about like $1,000?
That's fair.
Sick.
Give me a fucking give me a Euros and a fucking give me an Asbo. There's two cars.
Damn, okay.
Jimmy.
This motherfucker, dude.
What?
Jimmy, don't.
What? What's going on?
Jimmy.
Is everything good?
I think so. Oh my god. He's gonna get us shot.
Everything's good.
Would you get back over here, please?
Oh, I think it is.
Who do you think it is?
I don't know. Who do I think it is? Who do you think no it is?
Ah.
Hey! Why aren't you working?
Oh shit.
There's no FTO to take me, that's why.
I'm an FTO now. Just
No,
get
you're
in.
not.
Yeah, here, take my AR.
You're not an FTO. It'd be wonderful if you were.
Hey, Emma.
Be like,
Be a great
Cortez, pick
FTO.
me up. Will you though?
Probably not, because I'm just going to tell you, show up secondary so you don't have to do paperwork.
Unless the first one on the scene is an interceptor or a police bike, then you'd have to do paperwork.
No. It's still theirs. You just have to transport.
Ooh.
Big brain. No. Listen, sometimes you just, you know, you spin your car out when you're on your way, and it's just like, oh, damn. Looks like I'm not gonna get there first.
Oh, mullet, 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 mullet.
Sick. That's your person right there.
Hello.
Hey,
What's up? How you doing?
I hear this is the place I can get some wheels.
Yeah, what you looking for?
Something cheap.
Okay. Like, price range?
Like 10 to 15,000.
Okay, okay. Chat, I got this, I got this, I got this.
Huh? What?
Okay. Oh, I'm not in the game. Okay, alright. Hold on. Let's act like we know what we're doing, okay?
Oh, yeah. Oh, that's fine.
Like, compact, SUV, what you thinking?
Oh god.
You got anything that
Chat over here with.
a little more badass?
Okay.
Maybe
okay.
muscle,
Okay.
low end. Yeah, that's a little more my style.
Yeah, I don't think you're gonna find much for 15 here. The cheapest one. This one's at 15.
That one's what?
This one's 15 grand. This one's 11 grand.
11?
11.
I'll take it.
All right, hold on. Do you want to take it for a test drive, or you just want to full send?
All set. I got places to be, stuff to do.
Okay, well. Can I have your ID, please? Oh, he's new. Is he not on the text box? There you go. Thank you. Oh my god, my gun. Okay, and your phone number?
One sec, new phone.
All good.
New phone, who dis?
Oh, he got it, he got it, he got it. Sick. So typically we do 5% discounts.
Sounds good to me.
So that would put you at 10,450.
You take debit?
You have to go to the bank right down the street on Legion and transfer 8149 the money. This is hard to explain to somebody new.
Transfer 8419, you said?
8149.
And the total amount is what?
10450.
All right, I'll head down to the bank.
Okay. And then come right back here, and I got you.
Okay, sounds good.
Is he gonna walk there?
Hello, Emma. Good, how are you? Ten, 4, 5, 0. Oh, hell yeah. Is there any that she likes particularly? Don't tell me another cop is about to become our fucking neighbor. Oh god, where's her house? Dream house. Like Vinewood? If she says Kelsey's house, I swear to god. Oh shit, that's sick. Oh my god, she'll be Jimmy's neighbor. Everyone's gonna live next to a cop. Oh, sick. That's good. For sale! Woo! Is Rose still in the chat? I need help with the pink slip shit. I don't know how to do it. Oh, that's good. Pink slip transfer ID. Okay. Good night, Brandon. Sleep well. Thank you for popping into the stream. Okay, that's actually way more straightforward than I thought it was gonna be. Okay. Oh, it's red.
No, is this Virgo custom?
Yep.
Nice.
Hold on. Well, that's as close as we're gonna get. I make sure to get him if he wants what I'm trying to do. But like I guess that's enough, right? Half a quarter tank full. Empty. Oh shit. Okay. Meet me in the back. Go to the back circle thingy. I know. Back it up. Yeah, but there's people. I'm not doing that.
Oh.
Is that up enough or do I have to go for more? That's fine. That's fine. Okay. Oh shit. Eight, 5, 9, 5. Okay, you should be all set.
Perfect. I appreciate it. Thanks for hooking me up. I'll be back when I'm looking for something with a little more power.
Sounds good.
Forget to park it at all. It's really quick.
Oh.
Oh, hey, what are you doing?
Thank you, Banana. Uh, 6'5". He's off to rob some banks now, I know. Okay, I gotta write down the plate number. It is 6'5". DC.
There you go. Got it.
He crashed. 6'5" DCH 26.
Like, you just got red line some work too. Oh yeah, you saw the car.
I know, that's crazy.
Hi.
Hello.
How's it going?
Good.
It's good.
So we're gonna give the
Selling cars recently.
So I just fucking did. So I feel.
Nice.
Oh, yeah, I gotta go tell Cortez. Is he still here?
No, he went to a call.
Damn it. I made $550.
Nice. Better than nothing.
True. Yeah, he's gonna go rob banks now, and Arya is not to blame. Okay. Thank you. Thank you. Does anybody know how to deposit to a business? Because I'm supposed to deposit money to the business, but she said that I would figure it out, and I can't figure it out.
What's the price on a Raiden?
You are not buying that.
Why not?
Use the guide? Alright, fine. It is... Hold on.
Foil Raiden.
With a 5% discount.
With a 30% discount.
I'm not doing that. It is 71,250.
Bro, I could buy that right now.
You're not buying that right now. You just got a free jug. Shut the fuck up.
Bro, it sucks having a girlfriend as a car dealer. Fucking man.
I'm gonna hit you with my tablet.
I've got to look the other way.
At least it's not a flashlight.
I could get the flashlight.
Come on. No, don't do that now.
I'm joking. Listen, Bishop, I joke. I don't actually hit people
I'd like
with
to
flashlights.
report domestic violence.
Oh, shut up.
No, honestly, she gets a free pass. She took care of me while I was sick.
That's good. You feeling better now, though?
Yeah, I feel better. And to answer your question, how do you get a free jugular?
Also, thanks, Pierre and Saf. I appreciate it. My anklet stuck on my chair. Have rich friends.
he got a free one, but he don't know.
I mean, I know how I got it. Just gotta have friends in high places or something. I don't know what the fucking saying is.
Have rich friends who don't have any other friends but you.
He has other friends.
Yeah, but of all people, he gave you the jug, so... And don't look at me, I have no money.
I want a Voltic. Oh my god.
Lady, buy a car!
Gymnastics over there.
Buy a car! Buy a motherfucking
Okay, look,
car.
you don't oh, stop. You don't work at BNS, okay? You gotta be a better salesperson than that.
Please buy a car.
Look. Lainey, out of any car here, which one would you pick?
Actually, I've been having my eye on this one.
I mean, she has a Panto, so
Okay,
she needs
great.
an upgrade.
Hey, nothing wrong
Wait.
with a Panto, okay?
Pantos try to kill
Look,
me on the
look.
road every single fucking day, okay?
Let me give you a sales pitch here, all right?
Okay, okay.
Can I have a minute of your time?
Oh my gosh.
Okay.
Don't ask that question. People say no to that.
Okay, and that's when you say, look, it's just 60 seconds. All I need is 60 seconds. What can happen in 60 seconds? Not a whole lot, right? You know what can happen in 60 seconds? I could change your life with this car. So you drive a Panto, right?
Yeah.
What do you do for work?
I'm a cop.
Okay, so you're a cop, right? So you make good money, right? Like, and all your cop friends, I'm sure they're not driving Pantos.
I know one has a Cortez has got a really nice expensive car.
Okay, and I'm not saying you gotta be like Cortez, okay? You gotta be like Laney. And you know what, Laney? I think this car suits you perfectly. I could see you driving this down the road, you know, just that man, I just it leaves me speechless how great this car looks for you. You're gonna get better fuel efficiency. You're gonna get more
I don't know.
for
The
the
Panto gets
money.
pretty good fuel efficiency.
Oh my god, the fucking Panto. Oh my gosh.
Okay, look, efficiency isn't all about the miles per gallon, right?
Yeah.
How
but
long does it take you to get to work in that little Panto?
Well, I mean, I stop at every red light, so.
Oh god, she's a goody goody.
Okay. Well, that doesn't matter, because you'll get to those red lights fucking 30 times faster in this bad boy, alright?
And I also go the speed limit, too, okay?
Oh
Okay,
boy.
not all cops drive the speed limit, and I will not bend on that one. I know for a fact that all of you don't drive the fucking speed limit.
I know I do. So.
And
I'm
look,
just
you're
going
already
off what I
breaking
do.
in those tires. You know, it looks like you're having a lot of fun in this car. And you could be having fun in this car every single day, whenever you want, when you own it. Not if you own it, when you own it, Lainey.
Oops, I did not mean to do that. Does she even have the money
How much
for
is
it?
the links? How much is the links with a discount? But I also like the Panto because it's an ocelot. The Panto is also very unassuming, so not a lot of people like look at it and shit.
With a discount.
Okay, look, Lainey.
Would you let a 5% discount? It's 56,050.
Oh my god, what a steal, honestly.
The only thing is that don't leave me with much cash left over, so.
Yeah, but car you could live
Okay.
in. Fuck the house. Buy a fucking car.
And look, cash comes and goes. The only complaint you're going to have about this car is that you didn't buy it sooner.
I mean, I could always eventually hopefully get a couple shifts in this
Yes,
weekend.
live
and
in the
then,
car.
Get it next week.
Or you could get it now and get those couple shifts in regardless.
Yeah, you could get it. Yeah, get it now because if you get it now, Cortez owes me $1,000.
Damn. Actually, I probably want to test drive it first.
Oh, say less. Oh wait, Oh wait, I got excited there. Okay, come here.
Okay.
May I please have your ID and phone number? Oh, that was quick.
And there you go.
Oh shit, your birthday's coming up soon.
In December, it's still a couple months away.
8-3.
God damn. Okay, how did that go? How did you like it? Was that a good sales pitch? I just gotta ask.
Hi, Spirit. I hope I'm doing a good job. I sold a car.
I think that doesn't know I'm gonna go over the way over here.
How much are test drives again?
It is a $500 deposit fee.
Okay, I gotta go to the bank then.
Okay, you could just transfer it to 8149. Or you could do it cash. It doesn't matter.
Okay, A149. I'll be right back.
Wait, cash is probably easier. Because I have to give it back. No cash. Okay, never mind. That's how you get robbed. I mean, Jimmy's here and he has a gun and everything. I'm not too worried about it, but you have a point. She just took Emma's car. 646 3889. Okay, so overall, we have to deposit to the business. Wait.
Psst.
What?
Are you mad at me?
Why would I be mad at you?
I don't know. You kept looking at me like you're all mad.
You just did a good sales pitch. I was just studying.
You.
Of course. I gotta take notes.
No. I'm a shitty salesperson, honestly. I just talk out of my ass for the most part.
So, like most things, or?
Yeah, exactly.
So...
I want to buy Vinny's Voltic.
You're gonna buy his Voltic?
No, I'm not gonna do it. Not doing it.
I'm gonna kill you.
Okay.
Okay.
Oh, okay.
Oh, just a girlfriend telling her boyfriend she's gonna kill him because he's gonna buy a car.
I know, I'm just poking at you. Here you go.
Thank you. So it is 1100. That's what I owe the business. Spirit, correct me if I do something wrong, please. Okay, I'm gonna go get the keys for you. Hold on.
Okay, I'm holding.
Watching you like a hawk. Okay. Not at all intimidating. Not at all intimidating. Oops, that's not what I wanted. Okay, follow me. I have texted Cortez that you have stolen a test vehicle, and he thinks...
Oh, God.
I'm just kidding. Okay, now, you have 10 minutes with this vehicle.
Okay.
P033.
Wow, this is a beautiful car.
Okay. Bring it back in one piece, please. You are all set.
I will.
P033. I gotta write that down.
Hey, Rye.
Yes.
Well, that's a nice startup sound.
Can I test drive a Voltic?
Yeah, but you have to wait. And
Okay.
if you steal it, I will shoot you.
What? They're threatening to kill me.
I'm not. I just don't want to get fired on my second day.
Why would I steal it? I wouldn't steal it from Aaliyah. I wouldn't steal it from you.
Okay. teasing you, by the way. As long as you don't pull a Carly, you have nothing to worry about. Well, I mean, I don't know what Carly did, but oh, I want Arya to find out in game. That'd be fucking funny. Oh yeah, the dad. Yup.
I need to grab cash, don't I? I'm gonna go get you cash really quick.
Okay. I forgot Aaliyah told her. So yeah, she just sold one car, to a new guy, to the city. She has made a $500, and that's it. What are you doing?
Nothing.
I know, Arya's very calm. For what it is,
If I
this
buy
is
a
actually
Voltic, I'll buy it from you, by the way.
good.
Hey, I'll make a fat fucking commission check off that.
I am looking forward to it.
Yeah, except you always tell me not to fucking buy it.
Yeah, don't buy a car right now. Save your goddamn money.
Alright, how about this? I'll buy the Voltic when I can afford to buy 2 of them. How about that?
That's a good compromise, honestly. Oh man. I told Lainey that I called Cortez and told him that she's still a test vehicle.
Pretty savage.
Yep. So I told her to drive it like she stole it.
Kind of sounds like my jugular.
It does.
Got a really nice sound. I like the startup sound to it too.
Damn, all the cops are gonna be driving expensive ass cars. What the fuck?
This one's not too expensive though.
No, it's not.
No. Handles really well too. For stock, it does.
Oh shit, it sounds like a Komodo.
Yeah, she's gonna be wanting to test drive it.
Yep. Sick. Alright, the vehicle looked fine. There you go.
Oh, thank you.
Don't get robbed.
So you buying it?
Buy it.
Hmm.
Do you know how proud it'll make me to text Cortez that I sold a second car? Do you want to be part of that?
Don't buy it for her. Buy it for you.
I mean, true, but still.
I really want to.
Invest in yourself, Lainey.
Yeah. Do it.
What do you think, Eva? Should I get the cart?
I mean, you work all the time.
Yeah, do something nice for yourself for a change, you know?
You ain't no help at all.
Yeah, because she wants you to buy a house from her, but you can just buy this car now, and then you'll be fine.
Fine, I'll buy the car.
Okay, fucking sick. Okay. Well. This is a great fucking day, oh my god. Alright, so. You are to deposit 56,050 to 8149.
Okay. 56,050. Okay.
Yes.
Okay, I'll be back then.
Sick.
Can I get my test drive?
Yes, can I sell a car first? Okay, I know your ID number. I know what it is. Don't even give me your phone number, because I know that one too.
Izzy, okay? Multitask.
Listen, I just told you as we were running from the bank that I don't do multitasking well.
Okay, okay. Take your time with the car sale. I'll just be waiting here for my test drive.
Okay, let's fill out Lady Bishop's shit. Since she's now buying a car. $56,050. Sick. Okay. It is 8-3. He's so dramatic. No life at all if he isn't living the Ferrari life. True. Honestly, just full send. He has a Ferrari! Does he want a second one? Because Arya will totally give him a second one.
Alright. Should get the money. I don't know, maybe I just felt like running for a little bit.
You run for a living, basically.
True.
I don't want to brag, but yeah. Sports. I'll get better at finding everything in a minute. Alright, I'm sending it. Ah, hello. Let's try backing it up since... Okay. Let's put the gun away. You didn't see anything.
Nice.
Okay, it is 8395.
Woo!
There you go. You're now an owner of a
Thank
brand
you.
new car.
Yeah, but now you can go text Cortez that you sold 2 cars.
Oh, I'm gonna call his ass and tell him, because this is fucking great. Are you satisfied with your service today?
Yes, I am.
Hell fucking yeah. Okay, sick. Alright. It is yours to take. And
Yay.
what's even better is you came with friends, so now you can just drive it back. Make sure you park it. Don't forget to park it.
And thanks for the house tours, Emma. I had a lot of fun with that. Probably gonna go park this thing up and go to bed.
Thank you for your vote of confidence in Premium Deluxe Motorsports, even though I don't work here.
Oh Lord. Well, you guys have a good evening.
You
Yeah.
too. Right, so it was. How much did she give me? Again?
Oh, God.
She hit something.
Alright,
56.
give me a test drive.
Okay. Hold on. Hold on. Woo, we're making money. I actually don't know Jimmy's number by heart. I gotta fucking 852. Okay, what was the car again?
Oil Voltic.
Okay, I'll be right back. Thank you. I mean, I know you well enough to know you won't steal it, but okay. We're literally dating, but it's fine. Okay, babe, go over here. Okay, that color is actually pretty nice.
Hell yeah.
Please don't get pulled over.
I won't.
G885. Okay, I don't know how he did that, but... Okay.
Hello.
Hello.
So, how's everyone over here doing today?
Good. I sold a lot of cars today.
Really?
2.
How many? Nice.
Yup. Yep, I sold some new guy, Daryl, and then Lainey Bishop bought a car. That was expensive.
Oh my god, she got rid of the Panto?
Oh,
Fuck yes.
nope, she didn't get rid of it. She still has it. She just has a Ocelot now. Lynx. Which is a very different car from the Panto.
What the fuck?
Hey, I don't
Speaking
mind.
of very different cars, do you happen to know discounted price on the Segoy? If you're working with someone right now, then you finish what you're doing.
How the fuck do you spell Segoy? Squint.
Oh, yeah. Sorry.
Oh, it's SU.
Make might
That's
help.
No, it's good. It's good. Jimmy's just taking a car for a test drive, so you know it's just Jimmy, so I'm not too worried about it.
Yep.
Discounted, it is $87.50.
Ow.
But
Ow.
the regular is 85, so you'd be saving $5 grand. A little less than that. 420 something.
Owie. Anyways.
I want one.
No.
Wait, that's a Voltic. Didn't Fontana just post an ad saying he's selling one?
Yeah, but I'm not allowed to buy it.
No, 80.
Why?
87.50.
Say my
80.
buddy.
Oh, whatever. It's fine. She knows what I meant.
Oh, I kind of was saving my money, but I also have a car in mind that I kind of wanted to get.
No, no, no. Wait, let me correct myself. It's 80750, just so you know.
80K 750? Okay.
Yeah. Sorry. I said 80 and then 7, and then I realized that it could be translated as 87.
Yeah, that's what confused me.
Sorry. My brain doesn't like numbers.
Whose brain does?
I don't know. Doesn't help that I'm like math disability. Oh my god, I thought it wasn't even on. My brain doesn't like life, but here I am. It was severely damaged, so you don't get it back.
Mm-hmm.
He's like, yeah, fuck off. I'm just kidding. Trying to overcharge people? That's my plan, guys. We're gonna make the business hella money. Would you like to test drive it?
I've driven them before. I just really want to get one. But, you know, money.
Tell me what you're up to. Tell me everything.
This one is also on my list, though.
A Karen.
An Astrope.
You know, incognito.
I'll say.
You don't see anybody driving in Astro. And even if you do, it's mostly local traffic.
So I owe the business. Five, 6, 7, 7K. I made the business 7K today. Well, shit.
When was the last time you posted an ad?
I didn't even post an ad. Everyone just showed up while I was here helping that guy over Twitter.
I mean, that's basically your advert there was Twitter.
No, you're right. That is wrong. I just saw what I looked at. Wrong thing. How the fuck did you get 7K? I don't know. My brain doesn't like numbers.
I'm gonna go run and deposit this money back.
What do you say?
He's running to the bank.
Oh, okay, yeah. Yeah, no, I just, met up with that guy that I was tweeting at, and then Lainey showed up, and Cortez showed up, and yeah.
Oh, bet. Cortez showed up at PawnHub, too.
Sick.
Sold him 3 laptops. Also gave him the name of whatever couch he was looking for, because, let's face it, furniture is a really weird thing when it comes to Crapia.
Yep. Spirit, I look under the commission tab, right? Because I was looking at the wrong thing, and I just almost just cheated the shit out of myself. I told you, I have a math problem. Even though the numbers are here for me. Just an idiot.
Well, I should get back to the shop and either close it down or chill there for a bit.
Oh, sounds good. If you want company, let us know.
Will do.
Yeah, okay, so it's under the commission thing. Good to know. I was looking at the wrong thing. My brain does not like that. It's not just Arya that doesn't do numbers, it's me. Yep, it's me. It is me.
So she's not buying a Segoy?
Something tells me she doesn't have the money for that. Potato. That's me.
I mean, not a lot of people have 80 grand laying around.
Okay, Mr. fucking whatever much you have.
I work hard for
Okay. I owe the business 3,500. Good to know. Good to know. Carly, I don't think Carly worked at PDM that long. She didn't sell. I can actually look that up for you, actually. Bay Segoy. When did he get it? I did? I mean 3K? Fuck yeah. I don't think he bought it from anybody. Oh, no, he bought it from... He didn't buy it from PDM. He bought it from... somebody else. Carly hasn't worked at PDM for a while, I think. Because her name isn't on the sales in the last few months. Yeah, Casey's. I knew it wasn't from there. Jimmy, are you on the station? Did he go to the bathroom? Yeah, he did. Yeah, I see him peeing in the corner. Oh shit, let's call Cortez. Hopefully he's not busy. Alright, let's not let it ring too long. Jimmy!
What?
Oh, hold on.
What?
Did he get DC'd? Hello?
Hello?
Guess what?
What?
I sold another car.
What?
Yeah, Bishop bought an Oslet Lynx.
Oh my god, why would she do that to me? Alright, well I'll get you your money. I just got finished doing a triathlon.
Oh, that sounds hurting. That sounds like it hurt.
Yeah, I was just got done swimming.
Well, I'm guessing you just didn't do that for fun.
No.
Did you get
No.
them?
No.
Oh.
Because they're a rat.
Oh. Damn. Alright, well, my bank account's 8149. Or unless you want to give it to me in person and see the smirk on my face.
Yeah, I'll give it to you in person. I'll, just give me a minute. I think we're heading to another call.
No, you know, take your time. I'm like not saying now, but let me know and then I'll meet you somewhere.
Okay, you're not gonna send someone after me, right?
What? No. What kind of person do you think I am? What the fuck?
I don't know.
I sell cars, not hit lists.
Okay. Alright, well, I gotta let you go. I gotta put gas in my car and catch up to this chase.
Okay, good luck. Bye.
Alright, bye.
Alright, we gotta go to the bank.
Okay.
Oh no, oh no. Let's just look at the satisfaction of the bank account not being that low until we deposit the business deposit. Thank you. Okay, so it is business deposit 3500. Did it work? Hello? Hopefully that worked. I mean, nothing came up, but let's see. Oh, okay, it did not work. Okay, good. Maybe it's just one word. Huh. Huh. Okay, yeah, I'm doing it right. Do I have to be at the business? I don't think so. Let me... I don't think Spirit's still in chat. Let me just DM her really quickly. Huh? Oh, you're still in chat. Okay, I was just about to DM you. It won't work. I don't know what to do. That's be at PDM. You're good. You're good. Don't worry about it. I just want to give the business money, but I don't know what the fuck. You're doing it right? Well, then why isn't it going? Hello? Hello? I would like to deposit money. Oh, it has to be in cash. Sweetheart. I just realized that, okay? Okay. Listen, I'm new at this. I don't know how to do business shit. Okay, it worked. None of us in chat realized either. True. What the fuck?
Alright, where are we going?
I don't know, wherever you want to go. I mean, I could just keep PDM open at this point.
Yeah, it's up to you.
Nah, fuck it. Let's just open it for a little while. Babe, I have a job. This is fucking crazy.
Oh, hell yeah. Job.
Alright, I'm going to the bathroom. Back.
Okay.
I have to pee so bad. Oh, that's not my office. Just kidding. Just kidding. Okay. I will be right back. I have to pee so bad. Hold on. Fuck, we're dreaming all the hydras while I'm gone. Also, hello. I'm stuck, I'm stuck.
Ow. Why'd you do that?
It was a greeting.
By the way, I haven't gotten a kiss since I've seen you. Just so you know, I said that.
There. I haven't walked over. Damn. Charlie makes all these reconnections with Arya, calls her and everything, and then doesn't come to visit. Sad. Sad day. I got a cup full of goldfish. It's my ass. Need the snack. I also have my boss. My bosses made me ribeye today with potatoes and broccoli, and it's so good. Oops. Hello. This is weird. I'm not streaming on YouTube anymore. Today's day 1 of not streaming on YouTube. Yeah, it took a lot of pressure off the computer. My computer was running fine before, but I found a way that I could export it from Twitch to YouTube. Like that. So it'll still be going to YouTube. Just later. Alright, now that I'm subscribed over there, I mean, it'll still be going to YouTube. It's just, I can go onto Twitch. And I can easily just be like, export to YouTube. And I don't even have to, like, pull up another screen or anything. It just exports. And then I get an email saying when it exports. And I didn't know that feature until the other day. When my stream called, I think it was stream 98, episode 98. It got flagged. And it got, muted. Like, the whole thing was just taken off of YouTube, because of the song that I used in the beginning of it, and I was like, that's annoying. But if I upload it to YouTube from Twitch, it's already muted, so I don't have to worry about the song deleting the whole video. So I did that, and it was so much better, because then I didn't have to worry about YouTube being a butt. So, chat, realistically, what do we think of... Sorry, I ate way too many goldfish that time. What do we think of Elaina? I swore on her once, which is pretty good, considering I played her for 2 hours and Arya sworn like 800 times. That's pretty good for me. I swear like a sailor. In real life. So it's gonna be a challenge to play Elaina and not swear once. She was, but the first day of the job, I still don't have what she's gonna do if she swears. So. I didn't do anything for it, because I kept forgetting. I forgot what I said she was gonna do if she swore. And I want to figure out something to do. Oh yeah, it was give somebody $5. forgot about that. Yes, hello.
I think I'm gonna get going to sleep soon here. Do you want to go get your car, or are you gonna ride with Emma, or?
Honestly, I can just close and then go from there.
Okay.
Because everyone's...
It's up to you.
No, like, everyone's selling cars anyway, so it doesn't really make sense for me to keep this open. Alright, give me 1 sec.
Huh?
Emma. We're gonna go to bed, okay? Okay, I'll see you soon, okay? I'll be around tomorrow, probably. Sounds good. Alright, have a good night. We will, we will. Thank you.
Bye, Emma. You going to sleep too?
Maybe. I'll see you. Can we stop and get cookies?
Yeah.
Wait, wait.
What? What?
That's for you.
Oh, you know I don't like cookies, but I'll take it.
Oh, stop it. Just eat it. These are good. What do you mean? I'll get you a muffin next time.
I do like muffins.
Alright.
You wanna drive?
No. I'm not
Why
paying that
not?
repair bill.
I wouldn't make you pay the repair bill.
I'm good. Charlie and I kind of made up a little bit.
Oh, did you guys?
Yeah. We're on texting terms again.
Oh, wow.
I've called her a few times too.
It's good.
Yeah.
I knew it wouldn't be like that forever.
Yeah, we'll see.
I mean, it kind of seems like you guys are on different paths, but that doesn't mean you can't be cordial with each other and talk to each other once in a while.
Yeah, exactly.
That's cool, babe. I'm happy for you.
Thank you. She's not gonna tell him about Penny. She doesn't want to talk about it. She doesn't want advice.
Wearing a seatbelt, right?
Yeah, now I am.
Okay.
Uh-huh.
Is it really terrible to think that, well, is it really terrible of me to think that you were might about to get your seatbelt stuck on the door and fly out?
I mean, it's happened before, so.
Yeah, it may have happened to me earlier today.
Oh God, are you okay?
Yeah, I was going like 5 miles an hour. Sure does feel good to be up and about again.
It's nice to have you around. She is struggling so hard.
If that's too hard, no, don't crash into me.
You're good.
Jesus. So what is your plan?
I don't know. Probably just hang around. Not go far.
Yeah, I'm gonna go to sleep yet.
No, but I'll see you in there very soon.
Okay.
Love you.
Love you, beautiful.
Mm-hmm. They're fucking cute. So Arya has been, today at least, periodically sipping whiskey throughout the day. I can't drink the whole, I can't like do it on the thing because then she'll just smell like alcohol when she actually doesn't. So I could do the V's for it. I should have done that. I'll start doing it the next time. Yeah, we're gonna go check on everyone's houses. She's trying so hard to leave Mom alone and let her deal with her own shit, but she needs Mom. Alright, let's go check on Bay's house. She's never gonna admit it, though. But she knows that she's gonna be a burden. This bitch and her burden. Okay, Jimmy's sleeping. Penny's still awake. Yeah, Emma does real estate as well as the restaurant. Yep. She is a hardworking lady, that is true. Cortez must have got so many calls. There's no way Arya's gonna be able to sleep right now. She is a hardworking lady. The high from selling 23 cars. Everything else. She's really happy that she sold cars and made money today. She's kind of proud of herself for that, but, you know, she only could celebrate it, you know, in Jimmy, and it made her really sad. She misses the fuck out of everybody. She hasn't heard from Sam. She hasn't really heard from anybody, really. Except for Penny, but her and Penny aren't really talking right now. Penny doesn't want her to. Alright, I can't make her talk to her, so. She feels like she just, like, is very upset, you know? Yeah, but the Penny thing, the whole Penny thing broke her heart. She's really not doing well over that. Having someone you let in be like, I don't really want to be that close to you anymore. And summarized, obviously. You know, she's like, she's struggling. Nitro, I wasn't sure if that was you or not. I remember you saying that you needed to come in though. You're gonna come to the server. Thanks for the help earlier. There were so many controls I was struggling. I was laughing my ass off. We heard you crash. It was the funniest thing. Welcome to the server. I like your mullet. I got big plans for Daryl, how to get mod approval. Ooh, that's exciting. Oh, I wanted gotta check Yellow Jack. Yeah, true. You helped Arya get $1,000 from a cop. I talked so much shit for the last 2 months to Crumbs about his driving. I take it all back. Yeah, driving isn't easy as you think, honestly. I was so scared I was gonna crash your brand new car. I was like, ah, this is a lot of pressure. Under pressure. The laundry. I don't think I have any, but for some reason I passed it. Oh, that's what you were saying. I don't think I have any laundry, so. Yeah, when you said you wanted a muscle car, I was like, all of these cars, all the muscle cars are really expensive in the server. Which is a good thing, because then not everyone can get muscle cars right away, you know? I don't think I have laundry, but last time I didn't think I had any laundry without checking. I went to withdraw cash, and it was like $3 grand when I only gave like $1 grand, so. Just checking is important. No, he needs 15 or less for the muscle cars. True, true. Spirit knows her cars. Ask her anything you need to know. She works a character. She works at PDM. Okay, no laundry here. Oh, you can, you can fix the van and get money back on the deposit, just so you know. There was a new guy, Ari something in the server. Am I going the right way? No, I am not. And, he was streaming, and, today, and I popped in just to say hi and, like, just to greet him. And when I said hi, he was trying to put dirty in the laundromat. And I was like, he had 3 bags as inventory. I was like, no, 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 no. He's like struggling, like having a really hard time, and I was like, drop 2 of them, and then he did it, and then it worked, but it's one of those things. The M menu is your friend. It is your friend. Or you can do the slashes. The slashes I like do both. I do a mix of both. I might eventually get a stream deck, but that's like a far away thing. VM menu is kind of the thing I use a lot though. That'd be cool. Yeah, hella. That sounds hella fun. Hello, I'm here to pick up money that I probably don't have here. Yup. Okay, good. We collected all the money we had, which is good, because I always forget sometimes. I'm gonna go see if Crumbs gets away with the bullshit he's trying. Okay, good luck. I hope it goes well for him. Did I ever put Elaina off duty? That's the question. No, I mean like on the... Yeah, on the server I know I did, but... Making sure I did it on the fucking other thing. In the Discord. Okay, it looks like it did. TeamSpeak? I never went on TeamSpeak. I like connected and then I disconnected really quickly because I realized that I was going to be going into Arya and I didn't want to be connected. Behind the scenes, yeah. It is behind the scenes. Hell yeah, okay. Well, at least she's off duty now. Shit. Is that north? If we don't hear from Shane, he's lost to the war, noted. Shit. we got a call. I thought he was pulling me over. I was like, I didn't run anything. I was a good person right there. True, she has been drinking a little bit. True. Could have smelled it from her window. Yeah, it is due for a service. Speaking of, why am I having such a hard time today? True. True. Oh look, it's a one-way. fine. It is fine. You know what? It's fine. Yeah, Casey. Charlie. She didn't want to meet up with Arya because she's going to get chased by the cops. Yeah, see, it's right. You see that little number right above here? It is almost 2K.
What? You retarded or something? Oh, you piece of shit!
Yeah, I see it, but normally with the speed of fixing it, I can't. I see it now. Okay. Hello.
Oh, well, that didn't work. What we got going on?
It's at like 1,000 miles, so I figured get it checked.
Let's see what we got.
The blue ball spawns back into place once someone moves it, and everyone leaves the area.
Wheels and engine need done. Brakes are fine.
Oh, cool.
I don't remember parts costs off the top of my head, but I'll go pick up the parts and let you know the cost after the fact.
I know, it's all good. I don't have anything where to go be or anything.
Make sure I don't have anything here already.
Don't hit us!
Back when you're done.
Ew.
It'll run you like 1100.
Okay, sick. We'll give him a lot.
Appreciate it.
Of course. Alright, we're still at 30K. You said you, then typed you. Oh, I didn't even notice.
How's PDM going?
It's good. I sold 2 cars today.
Nice. Am I banned from there?
Let me look it up, actually. No, you're not blacklisted.
Nice. Anything exciting happening lately?
Okay. From what bundle? You're gonna do what?
Honestly, not really. Not gonna lie.
Nice.
How about you?
Actually, I guess not nice. Oh, the usual.
You know, the... Have you had anybody buy your cars yet?
I've sold 2 of them. I sold the Ingot and the Conjo.
Oh, that's not bad at all.
But I still have the... Yeah, I sold the 2 cheap ones. I need to sell one of the more expensive ones.
Yeah, that might be hard.
Yeah. If someone would buy my fucking Vista, I could finally get fucking LG Retro again.
I mean, would it help if people saw pictures of them?
I don't know.
I mean, you could post them somewhere.
But I'm also kind of lazy.
Yeah, no, I feel that.
And also, if I post pictures of my cars, people are gonna be like, I've seen that somewhere before.
Oh, yeah, actually, that's a good point.
Hi.
Hello.
How's it going?
Did you lose the cops?
In a foot chase, yeah, I managed to
Oh my god.
get somebody out of that car.
I was like, I hear her, I don't see her.
Perfect hiding spot. Easy.
How the fuck?
What?
He just came out of nowhere. I was not looking.
No, I had a car. I parked it behind the building over there. And then I ran over here.
Gotcha.
I think Penny might have gotten caught though, so.
Thank you so much.
No problem.
Wait, you were with Penny?
Yeah.
Huh.
I had a talk with her about some stuff that we talked about, so.
Oh god. You didn't bring it up, right?
Casey decided. Maybe.
Here, spill the tea.
She said she's kind of been like there's a reason why she's been driving by herself and stuff like that when you got like she's kind of been hanging out with the same people for too long. That's what she said. I'm like, what? How? Like, that doesn't excuse it, but okay.
Yeah. It is what it is. It's fine.
Are you fine?
I feel like that answers itself the past few days of what you've seen from my behavior.
Then no, you're not fine.
I'm trying to be.
Have fun.
Is that all she said?
Yeah, basically. I'm like, okay. How about we get out of here? Probably go to my house at least or something.
Yeah, I mean, there is a murderer after me.
A murderer? You didn't tell me he was a murderer.
He's not. I'm just over it being a bitch right now. I mean, at least I hope he's not a murderer because I should be more scared than I am.
Yeah.
Wow, my car's already so much better.
You still loving this thing?
Oh, yeah.
Ooh, that car is so sexy.
Oh, I did not mean to.
Easy.
Oops, whatever. It's fine.
It's fine.
Oh, look,
Go
I'll
in the
catch on
backyard
fire.
and talk. Don't catch on fire, jeez.
I mean, you put a fire out here, so it's not my fault.
Yeah, true.
This one looks like it burned, but I know that's not how it is.
Yeah, it's just black roses that fucking Nick gave to me.
Yeah, no, I'm glad that Jimmy's back. But, the last few days have been really hard, either way.
Yeah. Is Jimmy feeling better now?
Yeah, he's feeling much better, but, I didn't even tell him about Penny.
Has she, like, talked to you any at all since you guys had the little spat, or?
She came into PDM today, and we kind of were like, talking a very, very little bit, like, various formalities, and as she left, said she was gonna go to Pawn Hub, maybe close it, or keep it open a little bit longer, and I was like, let us know if you want company, and she said, will do, and then left, and then never heard from her again. And I didn't even know she was still around until I realized I was her with you in the car.
Yeah, I passed her on 68, and she asked if I wanted a partner, because I hit a store, and I went to try and hit another one, but it was locked up tight. I was like, fuck it, I'll just do a
okay, Shane.
ATM. And she was like right there, so I was like, fuck it, she's right here, have a little bit of fun before bed, because that's what I was doing anyways. So
yeah.
And I was thinking, perfect opportunity just to ask, what the hell's going on.
Yeah, I don't know. The whole thing that her whole reasoning behind it is, I get it, but again, I don't. I don't know. I'm just so tired of worrying about it,
Yeah, that's understandable.
And it's like, it's not even like it's just her that's so distant. It's a lot. Like, I didn't have Jimmy. I didn't have Sam around. I don't know. I haven't seen Sam in a few days. I haven't seen Kelsey in a few days. She's been dealing with some shit, so.
Yeah.
I don't know. I just felt like she was the only one around enough, and then to suddenly have her say that.
I haven't been and I haven't been around a lot either recently. Like a couple hours every day, really. So.
Yeah. So I was like, feeling like I was like all alone again, and it didn't help my mental state to have somebody really close to me that I let in and everything just like tell me, basically to fuck off a little bit, and I was like, okay, well, ouch, I guess.
Yeah, I mean, I can fucking see that.
But, it is what it is. She made her own decision, and I'm gonna respect it. Give her space that she wants, apparently. And
she'll come back after a little bit of space, maybe.
Yeah, but she's still fucking hurt a little bit.
Yeah, I mean, she could have went about it a bit better, I guess. But some people aren't used to having people around them all the time, and then sometimes it gets suffocating, I guess.
Yeah, I guess.
Still doesn't excuse the behavior, of course, but
I don't know, it's just... I don't like how this has gone to my head a little bit. Even if I try to fight off the thoughts, it's like, just driving people away is great.
And like I said the other night, I'm sorry for being distant.
It's not your fault. You had shit to do, and I was half part of that. So. I mean, I was mad, but I wasn't... I don't know how to explain this. I wasn't mad at you. I get it. And if it makes you feel better, Penny hurts a lot more than you did, the way she did it, so...
Yeah. Penny might be caught up in something soon.
What do you mean?
She told me an interesting tidbit. And I don't know if this is a good thing or a bad thing for her. But she said she ran into Mandy the other night. And Mandy told her that she's on a list of people that she wants to do something for her, which involves like shooting somebody or something.
Wait, Penny's on a hit list?
Basically, it's like a list that, from what I gathered, it was like a list of people that Mandy wants to go out and shoot somebody. Like, not like Penny herself's on the hit list, but that she wants Penny to go out and shoot somebody.
Oh.
And I don't know if that's a... I'm kind of feeling that's a bad thing. Because, like, it's... You know how they can be like, if they want you to do something and you don't do it, then... Yeah.
Why would Penny be on that list?
I don't know.
That's fucking
Like
weird.
I said, I don't know if it's a good thing or a bad thing.
Yeah, no, that doesn't sound like a good thing.
Yeah, I mean, I don't know if it's a good thing. I mean, I haven't really... Of course, I mean, they haven't really told me anything, but I mean, from what I've seen with hanging around them, the times I've hung around them, like, they don't even really talk to Penny or around Penny, so...
Huh. Oh, man.
Yeah, like I said, it is a bit weird, I guess you could say. And I'm honestly leaning towards it's not a good sign, you know?
Yeah. Yeah. I trust your judgment because you've been around them, you know?
It also makes you wonder, because I mean, most of the time, if shoot with them, like if they want somebody shot, they go do it themselves. So why would they want some? Why would they have a list of people, you know, that they want to go do some shooting, unless they're testing them?
I don't know, that's weird. Corruption list? That's what I was thinking. Maybe she got into stuff we don't know about.
Possibly.
Wouldn't surprise me. You know what she told me? That we don't tell her stuff. Like, she feels like she's filled in last on a lot of things, and I can see where she can say that, but I also can't see where she can say that because she doesn't tell us stuff either that goes on with her.
Yeah.
Which I get, but also it works both
I mean,
ways.
everybody's gonna have their own. Everybody's also gonna have their own secrets that they're not gonna be able to tell other people. Like, there's some stuff I've done that I'm not gonna be able to talk to you and Kelsey about. You know?
Yeah. I don't
So I mean, I don't. She shouldn't be. I mean, yeah, it kind of sucks to find out last about shit, but she shouldn't really be getting, all butthurt about it. At least
Right.
you're still finding out and not being kept in the dark.
Right. And the point that I made to her is that when we met up with Bernie, like face to face, Penny had been there and she left to go do shit. So her not knowing what really had gone on is her own fault. And I even texted her and told her, like, yo, he lied to our faces. He made up all these fucking lies.
Yeah.
Talked himself in circles. So I was like, you were there and you chose to leave and you would have been filled in on shit, but I still filled you in. So I don't understand why you feel like you were last to know about things, because we always tell you. I don't know. It's her choice. I get it. I really don't have the energy to bring it up again.
Fight it.
Yeah.
Yeah.
I'm so tired of fighting people for shit, and I feel like I'm 80 years old and I don't give a fuck anymore. I just wish she didn't tell me that the way she did, because that stung. Because I can understand, but it doesn't help the fact that it stings like a bitch.
No, that would especially, how she went about it, and it still might have hurt if she had said, if she didn't go about it with as snippy as she was, maybe say, hey, I just need a little bit of space or something,
Mm-hmm.
That still would have hurt, but probably would have been better than what she did,
Yep.
Especially since you two live together.
I know, I'm like, how are you gonna ask for space when we literally live right next to each other in the same fucking house? But I've been avoiding her just because I don't want to start shit, and I'd rather just let her come to me, because I don't understand how I can be suffocating when I'm always around everybody in groups and shit and never like asking, if you hang out, I ask you to hang out, you say no, I'm like, okay, see you later, then don't pressure. It's not like I force people to hang out with me, I just ask if they want to hang. There's a difference. I don't know. I'm just so tired of feeling lost like this. It's been like almost a week and I'm like losing my mind. And I haven't even told Jimmy, so I don't want him to treat Penny any differently. And I know he might.
Yeah.
But I miss Kelsey. It's been almost a week and I miss her so much. The kids fall apart without mom, that's for fucking sure. And me, you, and her still have to talk, so.
Yep. Is there anything you want to talk about right now? Anything you want to ask or whatever? Since we're here.
I mean, the drunk thoughts kind of came back slightly after you gave me like a quick review.
Yeah.
And I don't blame you for being distant. Everyone's distant. Shit happens. We were pretty much hanging out every single day, so I get it.
And well, it's like also like I said, I just didn't know who to really trust at that point when the two people who we've partially hung out with have been we're doing some shit, and yeah.
Yeah. I mean, I can assure you that, I mean, I didn't hear about most of that at all.
I mean, I haven't even. The only people who know that it was Jack that left the message was his PSP and me, and then now you. I haven't told anybody else.
Huh.
Because PSP is the one who found out it was Jack, and they told me.
Gotcha. Okay, that makes sense. Dumbass probably told him or something.
But the funny thing is he was very adamant that he was going to come after me and shit. For supposedly something that I had done that had put him in jail. And I'm like, he kept saying, you know, like ifs and all this stuff. And just didn't have like 100% facts that it had been me, I guess you could say. And when I confronted him, I saw him, it was a Wednesday night, I think. It's up at Pillbox. Somebody was in a hospital. I don't remember who.
Oh. It was Sam, because I was across the street. I saw you guys talking.
Oh, yeah. And I pulled Jack aside. I was like, Jack, can we talk, have a talk? And he's like, I don't think this is the right time. I was like, no, this is the right time. We need to talk now. I pulled him aside. And I asked him. I had to ask him 3 times if he had left that note. And he tried to deny it every single time. I said, Jack, I'm not fucking stupid. I said, I know you left that fucking note. And he finally admitted to it. And you know, he said he left that note. He said he was trying to scare me and get me to come forward and talk. I said, nah, I don't believe you right there.
Did he ever say why he did it?
He didn't exactly fully ever say what happened. He just said he ended up in jail and, yeah. He tried to say that, like the cops knew details about what happened before, like even though he didn't even know the full details about what happened. And I'm like, how am I the hell supposed to know? Yeah, like I said, how the hell am I supposed to know what fully happened if I wasn't even involved in whatever fucking happened?
That man was so paranoid.
And then the point, you know, if he was wanting to get me to talk, come out and fucking talk to me. Don't, you know, shoot outside the house, leave an anonymous note, and threaten to kill me, you know?
Yeah, that's kind of sus, honestly. I don't know, man. He pissed me off more than anything, honestly.
Oh god. Right, don't run out there. Let's go to the backyard.
Can you call Casey? Ask if that was him.
What's his number? I don't know if he'll answer or not, though. It kind of...
Ow.
I don't know what the fuck that was about, but okay. And some things are better off not asked. Let's just say that.
I saw that.
Yeah, I think it's the best idea if I don't call and ask him. Some things are just better off not asked, you know?
You see the kind of car that drove by? I missed it.
A 2-door or something.
It looked blue,
but I couldn't tell what kind, yeah.
How come every time I'm at your house someone shoots? What the fuck? I haven't heard gunshots in the city in forever, and every time I'm here, every time.
This is the first time gunshots have happened at the house.
I mean, I'm talking about besides the Jack thing. It seems like every time.
True. True.
And that other time where Jimmy and I is the downfall of our relationship when I was wanting to stay in here with you and protect you with no gun.
I still can't believe we're trying to do that. Like, seriously?
Hey, hey. I'm trying now, at least, right? Mirror Park is so odd of a place.
What do you mean?
I'm so glad I live in Polito where it's fucking quiet. If I check your front door and there's a note there, I'm gonna lose my shit.
Oh, God. I hope not.
No, we're good.
Is there no... Okay. Oof. That would have been some type of coincidence since we were just talking about it.
Okay, no, but the real coincidence is that we were just talking about what the fuck happened, and then that happened.
Right? I think I am probably gonna head to bed. You should probably get your car and head out before they start coming over here wanting to question and ask people shit. Yeah.
Okay.
Let's safe drive home, okay?
Okay. Sleep well, okay?
I will. You be safe going home and you sleep. Try to get some sleep as well, okay?
I'll try. I can't promise that I'm gonna sleep.
True, true.
I can't. I really can't.
The fuck's in the Camacho?
No idea.
Hey, you're looking good.
I know I had seen the Camacho like go that way. And then they came back this way.
Odd, but okay, whatever.
Yeah, very odd.
Wrong place, wrong time, I guess, right? Why? I don't know why it's always here. It's literally always here that I hear this shit.
I don't know why. Mirror Park seems like it'd be a quiet place, and yeah, this should happen. You expect it more like on the south side or like maybe up in Sandy Shores or something.
Yeah, no, it's always, no. It's wild here. Mirror Park has always been the wild place.
Oh, you saw my ad on Craplist. Whatever you want to do.
Alright. Let's go before I don't know what the Camacho's doing, so let's get out of here before they decide to do something.
So do laps around Mirror Park. Got it.
Fuck you, filthy pig.
No, that's not what I mean.
I'm kidding. I'm kidding. I'm not stupid like that.
I didn't say you were.
No, I'm chilling. Okay, get to your house. I'm not leaving until you're in your house.
I'm at my house, see?
Get in your house.
Oh, this guy's got to take a picture of his car.
Sir, I will run you over.
Damn.
Not really.
Oh, he got out of the way, though.
Yeah, oh, no, he's coming back.
Oh. Don't run him over.
Car Gaming, these are the follow. I'm not gonna run him.
Go.
To your house.
Okay, I'm going.
Sounds like Cortez is having a busy shift. I was kind of waiting for him. I hear Bay.
Business person from Huawei, the fucking electronics company.
I might kind of change
Yeah.
my plans if that's the case. I don't know if I want to really.
What's up,
experience
Kira?
that.
Yeah.
Hello, ma'am.
Hello.
Hello.
Oh, hi, Arya.
Well, hi,
How
babe.
can we help you?
Oh, nothing. I'm just on my way home, but I wanted to get a cookie. You know, hanging out in Mirror Park just now, and heard gunshots and decided to leave.
Oh, yeah.
That's a wise choice.
Okay.
The one time I hang out with Charlie. The one time right down the street.
Interesting.
Okay, well, gift shop's open, so enjoy.
They're like, okay.
Every time it's past 8 p.m., I usually give people a little grief about it. I say, hey, gift shop closes at 8. No more cookies. I mean, usually gift shops close when visiting hours end, and they're usually at 8, so.
Oh. Maybe we should get like some cones or something and put it in front of the gift shop whenever it hits 8 o'clock.
No.
You think that's
like
gonna
some
stop
sort of
people from going
barrier.
in there and taking shit?
Yeah, I was gonna say.
Sort of
It doesn't
barrier or
stop you from
something.
going in there and tearing down the duffel bags every time.
That's
Oh.
true. Listen, I don't experience the same thing. You know, I just don't see it. I guess.
Well,
Uh-huh.
I'm gonna go home. You guys have a great night. Be safe.
Mm-hmm.
Yeah, you too.
You be careful, ma'am. Take it easy.
Yep. Her and Bay are at a weird place right now.
Oh no,
Well,
you don't want to go to
another
fucking
spot-
Thailand right now. Not right now.
Another spot that I have been wanting to go is Portugal.
It's on the other side of the fucking world. Though,
On
dude.
the
I'm not
other
gonna fucking
side of the
complain.
world.
I know,
Yeah.
man, but I mean, I'm just naming places that I want to visit. Like,
This man says Seoul, Tokyo.
Rookie check. I know. I just rookie checked myself.
Around and go to Portugal after that.
Ever since Bake talked to Arya and she was like, didn't want to explain it because her and Penny had just fought, and you know that's his girlfriend. They've been in a weird place. Kinda sucks. Kinda sucks. So she lost Penny and Bay. That's who fired gunshots. I didn't know we lost Babe as well until just now. When he was like, oh hey, Arya. That was it. I heard my phone ringing. Oh, it was. Hello?
Oh my god. Hello.
Hi.
Hey. Yeah, sorry, I got busy. Are you busy?
I am currently not, yes.
Okay. Did you want me to give you your money before I get robbed?
Yeah, it's probably, I mean, if you want to, I was just, like, teasing you before about giving it to me right away, just so you know. I was just teasing.
No, it's fine. We made a deal.
Okay, where are you?
I just got off duty. I'm at MRPD.
Oh, lucky for you, I'm literally right down the street.
Oh, okay. Do you want to just pick me up from here then? I mean, I have my car here. Doesn't really matter though.
It doesn't matter to me. I'm like, I just passed because I was gonna go to Mirror Park, so.
Oh, okay. Yeah. If you want to just pick me up and then we'll swing over to the bank.
Bet. Okay, sounds good. See you soon.
Alright. Alright.
Bye.
Bye.
Yeah, that was the gunshot car. Yeah, I kind of figured it was Casey. Cortez, get your ass up.
I'm free.
Congratulations.
And I didn't get shot today.
Why you say that?
Because I've been shot at like every shift lately.
Oh, well. Yeah. Yeah, I mean, it comes with a job, doesn't it?
Yes. What, are you gonna shoot at me?
No. Hell no.
I'm writing this down. Alright, so since you completed your task so soon, I'll get you an extra on top.
No, you don't have to do that.
$1,000, you know.
I mean, to be fair, I may have coerced Bishop really bad into buying it.
Oh my god. Yeah, she was talking about wanting to buy that. Oh, there's Emma.
Oh, shit. I told her I was going to bed like an hour ago. Oh my
There you
god!
go. Double or nothing. Double or
Jesus.
nothing.
Alright.
Hey, Emma.
Hello.
I just got robbed. Help.
Yup, I robbed him. Yup, totally
Right.
was me.
Alright. Well, I'm probably gonna head home.
Yes, hello?
Okay, do you need a ride back to your car or something?
Yeah. Yeah, that works. Or over to Vespucci PD, because I live very close to there. Either works for me.
Sick, sounds good. Alright, Emma, we'll see ya. Have a good night.
Bye, Emma.
You're not gonna, like, give me
I
a
like the
ticket.
Granger, by the way. Huh?
If I run lights, you're not gonna give me a ticket, right? You're off duty.
I can't do that. No. Just look, listen. I don't know if I should tell you this, but I also run red lights.
Oh my god, so you're a hypocrite.
A little bit.
Oh god damn it.
You know where Vespucci PD's at, right?
I have never been, no. Oh.
Right down the street.
You know, I was driving
My
a
drive
doctor.
to work.
Oh, really? Sick. Now I know where
You're
to
driving
find
a
you.
doctor?
Yeah. I was driving a doctor, and they yelled at me for running all the red lights, and I was like, you can't do anything about it. You're a doctor. And he was like, I know I can't, but I still give you shit. And then he, you know, he's one of those people.
Was it King?
Yeah.
Yeah, he seems kind of like a square, honestly. You could make a left at this street right here. Just park at the back gates.
Ooh, okay.
I want to show you exactly where I live, just in case you try and kill me.
God, you really think that I'm that kind of person, huh?
No, I don't. You do not seem like that kind of person.
I'm very chill.
But yeah, you seem chill.
Alright.
Alrighty.
You be
well,
safe.
Appreciate it.
Don't do anything
you
crazy.
as well.
Okay.
I can't do crazy stuff anymore. I'm a cop now.
Anymore? What the fuck?
What?
Why'd you say anymore?
I mean, I don't know.
What'd you do before you were a cop, Cortez?
I worked in a casino as security, so it wasn't
gotcha.
that crazy. Yeah, it was pretty boring. Very boring, actually.
Well, damn, okay.
Alright. Well, good job. You completed your task.
Thank you.
Nice. Alright. Well, I will catch you next time.
Yes, sir. Maybe you'll be
Yes,
arresting
ma'am.
me.
Why?
I'm just kidding.
Why?
I'm kidding.
Okay.
Maybe.
Alright. Appreciate
Allegedly.
the ride.
Of course.
Oh my god, you and that allegedly.
Allegedly. I love Crispy. He's so fucking funny. Chat, now we have our money. What we gonna do now? Probably go home and get drunk, right? Yeah, I wanted to play it fair. I didn't want Jimmy to buy a car and then, you know what I'm saying.
Let's meet up next week.
2.5 hours ago you told Emma good night. Yeah, and then she just thought me in Legion and I was like, I didn't lie. I was gonna go to bed, but plans changed. Pretty sure that's KD's Camacho. Not gonna lie. But I have no proof. I know. Arya's saying a lot of things that she doesn't mean lately. Well, not like that, but she says like she's gonna go to bed and then she doesn't, and then she says she's gonna be in there soon and then she isn't. And it comes with her mental stability right now. It just shows that she's like not all shit. Small things compared to what others are doing, true, but it's more like Arya's saying, like, I'm gonna go to bed, and then she, like, sits down by herself, and she's like, I can't go to bed. Me too. Why do you think I'm able to play it so well? Crispy, what's good? How you doing today? Arya and Charlie were at Charlie's house when the fucking gunshots went off. I didn't find anything but casings. I'm sorry. With the car being serviced, you're not sliding as much? True, I'm not. I thought I was gonna get shot at again. Yeah, it happens. Oh, Penelope. Penny's still awake. Hitting that local was $132. Cortez basically paid for my service bill. I don't really have anything to spend the money on, so I'd rather spend it around for little tasks and stuff. Yeah, I get that. I get it. Y'all wanna go once around the whole thing? Let's do it. Fuck it. Told Emma you were going to bed. Nope. Listen, I told her I was gonna go to bed, and then when Jimmy and I got to the house, I was like, I'm not ready to go to bed yet, and I stayed up. Kinda just fucked around. Yeah, Bug gave me shit for it a little bit. It was fun. I realized what I did and I was like, oops. I mean, Arya's not in a great headspace right now. So, it kind of makes sense, honestly. Even if my brain forgot in real life because I'm a pea brain. I'm a potato. I saw Arya multiple times. Arya is such a bitch. She's in this headspace right now where she's like not okay and she's pretending that she is, but she keeps doing little things like saying she's going to bed and then not, and like leaving people and then like forgetting. So she's been doing little things that like that kind of point to mental instability and like no one's noticing, which is good because she's gonna get away with it. Aw, that's not it at all. She's spiraling right now. It's got nothing to do with Emma. She's not okay at all. She's having a really hard time lately. Emma knows she can see it, but until it gets to a certain point, she's not gonna. Yeah, that makes sense. Arya's a fucking brick wall. Newly serviced car, who dis? It drives so much better now. I don't know where the fuck I'm going. I got off the fucking highway. Fuck me. One day Emma will get past the wall one day. Yeah. No pressure, but it took everybody like months to get to that point with her. The only person it didn't take long for was Kelsey. That's because Kelsey's Kelsey. I am so lost right now. Where the fuck do I need to go? Oh, I was in the right direction. Sick. Fucking sick, bruh. Yeah, no, I get that. Get out of the way, bitch. Now it's the highway we know and love. I get it, Cyrus. Oh, and Bug, to answer your question, I read it, but I never answered it because Cortez called me. The talk with Charlie helped a lot. I don't know if I did answer it. Maybe I did. The talk with Charlie helped a lot, but Arya's at that point where, oh, I have no gas, where she really wants, she wants to tell Jimmy, but she also doesn't want Jimmy to look any differently at Penny. Blaming Cortez, nice, nice. No, I just mean like you called me and then I got distracted. Hasn't she what? Cortez is a precious character and nothing shall happen to him. But she talked to Charlie today and everything, and it was good for her. But she really just misses Kelsey a lot. And there's reasons why she's not around right now, which is fine, but yeah, Cortez quickly became Arya's favorite cop too. Because he actually hangs with them and doesn't treat them like civilian dogs. But no, so Arya just misses Kelsey a lot, and she wants to tell her so much. But no, she hasn't told Jimmy yet. He just got back from being sick, and she's not about to make it more dramatic than it has to be, honestly. She's kind of just like, I don't care anymore. Do whatever you want. I'm tired of dealing with the stress and the worry about it, and whoa, whoa, I saved it. I saved it. I thought I wasn't gonna save it. That's clip worthy though. That's clip worthy though. That's clip worthy. $19. Gamer. Major League Gamer status. Floppy, thanks for the follow. Appreciate you. Thank you for that. Well. Lady, will you run away? But if we're being real though, Arya just is a mess right now. She misses the fuck out of her family, who's like, they're all like, not around as much, so she's kind of just like struggling with that. And then I have a clip of Crumb somehow not eating shit while flying through the air in a chase today. Damn, okay. Go off, go off. But yeah, Arya just is a mess. Nice house though, thanks. Made it myself. I'm kidding, I didn't. Nah, she bought it from Devin, the realtor. This is Arya's nightly routine, chat. She just gets zooted out of her fucking mind. It's gonna change though. She's gonna start carrying a flask around and taking swigs from it as the day goes on. The Devin Klein, famous realtor? Yup. That be it? He's dead? Oh god. Yeah, no. It's a struggle for this bitch right now. Just stop struggling. Easy. Easy peasy. Just stop struggling. She's so good at adding it too, it's kind of scary. Have you just tried chilling the fuck out? Nope. Arya is not that kind of person. Oh. Bug, thank you for the clip. Ow. Alright. Her drunk ass is going to bed. See, the thing is though with Arya is that she bottles it in and explodes. So get ready for that day because it's coming if she keeps on this path that she's going. Dog, no. Hi, Dolly. Welcome to stream. Wait. All right. Emma's got 20 spare notebooks. Oh my god. Oh, man. I think I'm gonna go eat some of the leftover ribeye from today, honestly. Ribeye and potatoes sounds so good right now. When it's her primary method of communication, gotta be prepared. True. True. Elaina is surprising. But yeah, I was on Elaina a little bit earlier today. Got some doctoring stuff done, which was pretty nice, honestly. I didn't expect it to be as nice as it was. Yeah, I actually liked it a lot. But yeah. It was cool. I liked it a lot. We'll see what happens with her. She's a very innocent being. It's gonna change the longer she's in Los Santos, though. Doctoring. She said fuck once. She said fuck once. And when I did it, I was like, ah! But did you see that? She said damn once, and then she started saying darn. Darn. Yup. Started saying darn. Dang nabbit. Was it more than once? Damn, now I gotta go back and watch to make sure. But yeah, she's gonna start carrying around, like, 10 bucks in her pocket, and every time she swears she's gonna give everybody in the room $1. Yeah, that's what's gonna happen. Why are we playing, like, lullaby music right now? Oh, here's a good one. Yeah. I think that's it. I don't remember what else I was gonna say. I think I had something planned, but I don't remember what it was. I'm going to eat ribeye. Oh god, damn and heck are... Bro. Damn and heck were the ones that were like, I like loved as a kid. In 4th grade, I started saying fucking shit, and then it spiraled from there, and now I say it every fucking sentence. Gosh darn it. Sorry. Ow. Alright, y'all. I think it's time to go to bed. Is there anybody streaming? I think Thurnis is still fine. The magic trick, he just disappears. Crispy hasn't played Thurnis, I don't think. I was streaming earlier, but no one ever gets hurt. I was Arya. Arya's gonna get hurt soon, don't worry, you'll see her. With the way she's going, she's gonna get hurt real soon. I'm gonna perm my character just for you. Bet. Well, there was gunfire close to her, true. It's always when she's with Charlie. That's so funny to me. Not involved, but close. Have you even written death report yet, Dolly? The nurses will not write your fucking death report for you, okay? Okay? Nope. Not happening. Never. Nope. If you ask Elaina, she's too much of a pushover to actually say no, though, so... Yeah. Typical docs. Yes, fuck. Yes. True, he would be primary. My report wasn't that bad, was it, Dolly? Because I took a lot of time and I was so quiet for a while because I was just like so focused. For my first report, I think that wasn't that bad. At least. Oh, loading C passes off. Aside from MVA, yeah, I hit the wrong button, okay. I hit the wrong button. Just don't check Araya's medical report. We'll crash the system. I actually haven't looked at her report. I don't think I'm allowed to, technically. So I haven't. Oh, there's nothing against it. Oh. Yeah, I don't know. We'll see. I could ask. But that's too much effort. I don't feel like that. I don't feel like doing that. True. I wouldn't know. I already know everything that's happening, so. I think Arya would have more if she encountered more EMS. But, half the time she gets hurt, there's nobody on duty. So, there's that. That's probably why she doesn't get... Yeah. Okay. Alright, y'all. I think I'm gonna go to bed. My bed is calling me right now. And... it's been real. There's nobody streaming right now, or else I'd send y'all to somebody to watch on the fam. I think Crumbs ended. I saw that he was streaming. Dolly ended. Lux didn't stream today. So. Yeah, I don't think... yeah, there's nobody. It's okay. Raid me? Oh my gosh. Alright, y'all. I think we're gonna call it there. We're gonna go... I'll see you guys tomorrow. I'll be around. As always. I got some Elaina stuff done. I'm going to make, I'm gonna talk to a bunch of people. And look about a 24-hour stream. But that's not gonna be until after the streamathon on Friday, which y'all should get ready for that. Night, Hobby. Good night. So, hi, Lux. Welcome to the stream. But yeah, I'll have a more definitive answer after that. But other than that, we are gonna go say goodnight. Have a good night, everybody. Stay wild and weird. Peace. Also, it's gonna be more energetic than that. I'm sorry. I just need a second. I still have goldfish to eat. Fuck. Alright. Hold on. Let's get some fucking good songs to leave off on the night with, you know? We're gonna play, someone give me a song. Someone give me a song. XD Jones, 06, thank you for the follow. Okay, Crispy suggested a song. Wait. Is this gonna get me in trouble? Okay, no. I don't think so. If it does, it does. Fuck it. Alright, y'all. We're gonna call it there. Everyone have a great night. I will see everybody tomorrow. I will be working, but it's supposed to be gross. Wait. So I'll probably be on around... You're both green. It fucks me up. Lux, I'm sorry. Y'all are both green. If I look quickly, I can't tell the difference. Same with Cyrus and Shane. And A Banana and Shane. Y'all have the same colors. Crispy, you scrub, change your color. Tomorrow's supposed to be actually not that bad. So maybe there will be people. But I'll be out early anyways. So I'll see you guys soon. And yeah, it's weird not rating anybody. I don't know who to rate, but yeah. Antoine, thank you so much for the follow. Antoine, thank you for the follow. Right as I joined, I know, we're about to end stream, but it's okay. We got a song request, so you can stick around for that, and then I'll see you guys tomorrow because I stream every single day pretty much, so you can catch me then. I'm always around doing stupid shit, and we're gonna make our forgetful character soon. I want to liven up the server a little bit, so I might bring her in before the 24-hour stream just to get everything, like, just to get people riveted, you know? Can you imagine Wayne, Thurnis, and Dory, my new character, coming out of the shadows and just coming and fucking shit up? That would be fucking funny. Is there an age on the server? You have to be 18 and up. Welcome, guys. Welcome. Hello. Hello. Dang, I'm 15. Yeah, no, unfortunately. There's an age limit for a reason. Plus, the GTA itself is mature adult, so that's kind of why, too, probably. Most likely. I don't know. I'm not an expert. But yeah, alright. We're gonna call it there because I'm gonna keep fucking getting distracted if we don't. Sheesh, why you sheeshing? What's up? How you doing? Quan Gold Gang, thank you so much for the follow. Great. We're about to go say goodnight. How about you? I'm good. I'm about to go to bed, so I'm great. But yeah, alright guys. Thank you so much for watching. I'll see y'all tomorrow. Have a great night. Stay wild and weird. Peace. Good night, guys. We'll play y'all Lux's song now. Wait, hold on. There we go. Good night, guys. Peace.